too.
Cool. We are officially live streaming.
Okay, got it. Okay, thank you. Good afternoon. I want to welcome all of you to this meeting of the Oregon Early Learning Council on October 26, 2021. And Remy, will you please call the roll?
Angie Blackwell.
I'm here.
Excellent. Thank you. Katie Brooks is excused today. Peter Buckley.
Here.
Ann Kubich.
Here.
George Mendoza.
Here.
Dr. Peg Miller. I believe she is going to be in and out because she has hospital duties as usual in a pandemic. So she will be here. I'm going to mark her as present. Kali Thorne-Ladd.
Present.
And then Sue Miller, chair.
Here.
And then our agency directors are going to be present upon presentation. So that includes Pat Allen, the director of the Oregon Health Authority, Colt Gill, the director of the Oregon Department of Education, Margaret Salazar, the director of Oregon Housing and Community Services, and Liesl Wendt, the deputy director of Oregon Department of Human Services. And then finally, Alyssa Chatterjee, the Early Learning Systems Director of the Oregon Early Learning Division.
Who is here?
Yes, here.
Marking you as present.
Welcome, Alyssa. Good to see
Excellent.
you. Okay. Well, I want to start by thanking everybody on this call who has helped us prepare for this retreat. And I know everybody has spent time that they probably didn't have, but somehow you made time to provide input so we could have a really good agenda. And today's meeting, the retreat annually, is always where we provide the basis for the work plan for the coming year. So it's a very important sort of foundational time for the council to set our own priorities and expectations for what's ahead in 2022. And I want to say a special thank you to the members of our interagency implementation team. We fondly call it RUIACT, many of whom are on this call because I know you all spent significant time preparing the materials that are in our mural board that are also the basis for our conversation today. So thank you, RUIACT members. And I also want to thank our fearless council administrator, Remy Watts, who has spent untold hours prepping for this retreat. So thanks, Remy. According to state statute, this council, and I'm quoting, is responsible for leading cross-sector strategic planning that establishes the goals, objectives, and strategies necessary for a statewide early learning system. So it's clear from this directive that we need to establish priorities and expectations in tandem with our agency partners, both staff and directors. And I appreciate, especially in these crazy demanding times, how much time our agency partners are spending on our council work. It's really quite remarkable. Our council's North Star remains unchanging: to see that Oregon has and is implementing an equitable, integrated, and effective service system for young children and families throughout the state. Obviously, because of our 5 partners, we know the system includes early learning, education, health, housing, and human services. So as steps toward meeting this responsibility, here are some of the goals for the next 2 days for us. Number 1, listen for ways to better elevate family voice and to center equity in our work. 2, identify concrete ways in which we can serve as champions of our strategic plan called Raise Up Oregon, whether it's at the local community level or the executive or legislative level, and both public and private so including nonprofits and businesses and other private sector partners. 3, support implementation of the new early learning agency, the Department of Early Learning and Care, fondly called DELC. And as you know, council members, that was our #1 legislative priority. So huge impact on the system building and certainly a remarkable opportunity. And we'll hear a lot more about it tomorrow from Alyssa and some of her staff. 4, as the rulemaking body for DELC, we need to ensure that we build an equity analysis into all of the rules that we adopt. 5, we need to prepare to start thinking about our next strategic plan. Believe it or not, it may seem like we just adopted Raise Up Oregon, but it was a few years ago. So we will look forward to having a very robust community and stakeholder engagement process as we put together a strategic plan that might even include a comprehensive children's budget that some people are beginning to talk about. And 6, we want to emerge with concrete ideas for developing a work plan for the council. And the intention is that we'll create the priorities and discuss those today and tomorrow. And then in January, we'll actually have a draft work plan in front of us to try to implement and support those priorities. I want to very briefly acknowledge a topic that many of you, including our agency partners, brought up in our pre-retreat conversations, and it's not on the agenda. And that is the need for data. We recognize that we need to use outcome-driven data with key performance indicators in order to have accountability in the system. Thanks to the work of RUIACT, many of whom are on this call, there is a cross-sector leadership team that is working to prepare a dashboard that will provide metrics for us to track the well-being of young children and families in Oregon. We anticipate that the dashboard will be available for our January or February council meeting, and then we'll have an opportunity to discuss the metrics. I think we all know from our own worlds that data is always a challenge, can be pretty elusive, or you can be inundated with so much you don't even know what parts to pick. But we will be tackling that in 2022. So for the next 2 hours, we'll have a chance to discuss with each agency director what their early childhood priorities are. And as you know, they're largely reflected on the mural board. And we'll look at the challenges for implementation and then how we can support their work. I've assured the agency directors that we all are familiar with the information in the mural board, so they can kind of start with that as a basis for the conversation, highlight areas that they really want to focus on, and then have discussion with us. At 3:20, we'll take a 30-minute break. And then we'll reconvene to sort of digest and summarize, synthesize what we've talked about and heard from the agency directors. And then, as you know, there are 3 rule sets on the agenda that we will need to review and then adopt this afternoon. Before hearing from our agency partners, I want to officially welcome Lindsay Capps to our meeting. Lindsay is the governor's chief education policy advisor and a longtime friend of many of us on this call. In addition to Lindsay, we have 3 of the other governor's agency directors with us, advisors, policy advisors. I think they're all on. Rosa Klein, I believe, is here or coming for Human Services, Tony Lapietz from Health, and Ryan Dibert from Housing. So thank you for joining us today. I think we all know that many of the advances in early childhood over the last several years have been largely because of the governor's leadership and the fact that early childhood is a personal priority of hers. Lindsay has been a key advisor of hers in this effort, for which we are truly thankful, Lindsay. So I'd like to turn it over to you, Lindsay, for your comments.
Thank you, Chair Miller, members of the Early Learning Council, ELD Director Alyssa Chatterjee and staff and everyone who's here. I get the distinct honor among my peers to speak just very briefly at the start, but I do want to acknowledge Tony Lapise, who is our health policy advisor. If there's anything happening on COVID right now, Tony is providing incredible leadership. And so just to have him here partaking in the conversation for as much time as he can is a real honor, and just appreciate his presence. And I do want to recognize Efren Zamudio, who is actually the Deputy Education Policy Advisor, who's just joined us, who is working largely in the space around educator workforce, as well as youth development, which are both key connection points to early learning. And I'm pleased once again to be serving as the governor's early learning policy advisor, which is a huge honor and an honor to work with all of you in your work. I want to be really quick because, Sue, I don't think I could say anything better in terms of your framing of today's conversation. I would say that for sure the governor sees Raise Up Oregon as a major landmark in the work to build a equitable early learning system, a prenatal to 5 system, and the plan that is in front of all of us. The public plan is a cross-sector plan that many in Oregon help to inform each and every day, whether that is the families in our early learning system, our providers, as well as the cross-sector partners that contribute, whether those are governmental entities or nonprofit partners or critical community leaders and culturally specific organizations. This is a full lift to serve our children and to give them all a better start on their future. And there's incredible work underway, including the passage of House Bill 2166, which ties in well with this plan, especially around suspension and expulsion prevention and critical efforts to expand behavioral health supports for providers and, more importantly, children and families across the state. So I guess all that I would add, Sue, to your important comments is today's conversation is the appropriate and right role for the Early Learning Council to drive forward, to engage each agency in their work to help put into practice the strategies and goals that you all have articulated. And all of us on the governor's team, whether that's Tony or myself or Rosa or Ryan, those who work with each of these constituent agencies, we are here to support you and to carry forward the governor's vision around this work. And just really look forward to the conversations that we'll have today, and frankly, to the comments and planning that each of the agency directors will bring forward. All of them have been involved in this work and bring that institutional knowledge and commitment, both through their participation here at the council and through the governor's children's cabinet. So we have a lot to be thankful for, a lot to be optimistic about, and a lot of work to do. And we just want to thank each and every one of you for the commitment that you've made to our children and to equity in Oregon. And thank you for convening this conversation today. We're just honored to be here.
Awesome. Thank you, Lindsay. We are honored to have you here as well. And as I said, I know many of us on this call have spent several years and hours with Lindsay working on these education issues. So thanks for your staying power, Lindsay.
Thank you.
Okay, let's move then to our agency directors, our partners. And as you know from the agenda, we are going to start with Liesl from the Oregon Department of Human Services. Welcome, Liesl. Thanks for being here.
Good afternoon. Good afternoon, Sue. Hopefully I'm unmuted and you can hear me okay.
Yes, we can. Thank you.
Well, welcome to everybody, and thanks for having us. It was actually kind of fun to do homework for this presentation and reflect on how much has changed in the last year and a half to 2 years. When I pulled up the plan, it's still relevant, which is exciting, and I think some elements in the plan probably require more urgency from all of us as we think about the changes that we've all experienced in Oregon, and I'll touch on those in a little bit. For the first question, I did just want to share kind of where ODHS is and has been over the last year and a half. We actually have recently launched something we're calling the Future of Human Services, and building well-being together is the way that we're phrasing kind of our future state work. And part of the reflection that we've done over the last year is recognizing some internal pieces of work that we need to improve upon, particularly our hiring, recruitment, retention practices to ensure that we're recruiting and retaining a diverse staff. So that's one of our number one priorities in our HR functions. The other is being grounded in our Equity North Star, which we completed about a year ago, and Angela can drop it in the chat, which has really been guiding much of our work over the last, well, more than the last year and a half, but certainly the last year. And, you know, what's interesting for an agency of our size, we have about 11,000 employees, about $11 billion of a budget. And we, until about 6 months ago, did not have a single person dedicated to community engagement enterprise-wide and Oregon-wide. And I'm reading to leave.
Wow.
Right. So when we had community coming to us, you know, during COVID in response to the wildfires, any number of issues, they, you know, more or less said to us, we don't want to navigate your bureaucracy because we're really 5 programs in one. We want a single source of contact. And so we decided we needed to create that position and build out much more intentional community engagement strategies. We've done it in a reaction way, and we want to be much more proactive about engaging with communities. So we hired a woman named Stephanie Stevens, and she's really hit the ground running and helping us build a framework. And we won't go too much further in building the framework until we actually talk to communities. So we're in the midst of that work and very excited about it. The other piece is being more intentional about co-creation with our customers. We serve about 1.5, 1.8 million, depending on caseloads at the time. And as we've launched the One system, we were very internally focused on how to do that. And now we recognize we need to be much more externally focused. How do customers want to experience us? Now that we have sort of more modern technology, what would it look like to meet us in community partner agencies or online or insert what have you. So we'll be launching some work engaging our customers and co-creating that work together. So that's a big shift for us in the midst of everything else that's going on, but I think one that's propelled by Fair Board's vision, propelled really by the governor's vision, and I think now insisted upon by the times that we're in. So we feel like we have some momentum on our side. The other pieces that, you know, when we talk about challenges or barriers, you can't really talk about that without talking about crisis response. Some of you may know, and I think I talked about this at a meeting or two ago, DHS has a responsibility for mass care and feeding in a crisis. And that's not a role we've really had to activate to scale before. And we certainly did when the wildfires hit last year. In fact, we're still housing about 650 people a night in hotels who lost their homes due to the wildfires, and we're still working with our partners at Oregon Housing and Community Services to find permanent homes for people. So that has been a huge mission lift that we did not anticipate, and we have a team that's doing that also in concert with community-based organizations. So I think between COVID, wildfires, weather events, the heat dome event, we've recognized that we'll have an ongoing role with, we're not even calling it crisis response anymore. We're shifting to community resilience because some of these pieces are, there's no way we can do the response on our own as a state. We'll have to work with our community partners and CBOs to really do the work in a community and culturally responsive way. So we've created an emergency management unit. We didn't have that a year ago, so we now have a formal unit that's taking on that work. And I should just mention in a timely fashion, they are also working with many partners, including the governor's office, on preparing for Afghan refugees who may soon be arriving and making sure that all of Oregon's prepared to greet people and house and make sure we're helping connect people to community. So that's a challenge, I think, for all of us. And I think the particular challenge for this group I would raise is we all operate in silos, we know that, but when crisis happens, we are dealing with people. And the siloed approach doesn't work, because when somebody loses their home, they lose everything, right? They lose their, I mean, I've sent many of you, and Peter in particular, I'm sure you've seen pictures. I mean, people lost their homes, their cars, everything. So kids lost their laptop for school. They lost their neighborhood connections, their friends, their informal childcare supports, all of that. I mean, when you drive through Jackson County and you look at the mobile home parks, just decimated. So yes, we can house people in a hotel, but they're no longer with community. And all those supports for the kids, for the families are gone. And we're trying our best to create those. And Anne's been a huge partner as well, and her staff as we sort that out. But I think that one solution I'd really love to see us think about is a pool of funding that could support families post-crisis. And you don't have to go to this door to get the one thing and that door to get the other one thing, but we have to meet people where they're at, with our community partners probably on the front lines of that, and then us more as a state as a funder. So that's one thing that we've talked a lot about and would love to partner with any and all on how do we get to that kind of a solution. You know, I think the other, and this is paramount after, or front of mind for us after the vaccine mandate, is workforce issues. We actually stood up an incident management team to be sure that we had enough staff the day after the mandate to provide critical services for the clients that we serve. So the hot spot for us was the state-operated Stabilization and Crisis Unit, or SACU, out of our Intellectual and Developmental Disabilities program. We lost a significant number of staff, have had a significant number of staff out on leave. So we've done everything from incentives to bringing in staff from other parts of the country. And that's a very vulnerable workforce that we have stabilized for probably 6 weeks, but and are recruiting anyone and everyone who wants to work in that field. So I think workforce supports, finding childcare, paying for childcare, recruiting and training staff, and not just for that program, but across the board, we've seen staff reductions and are challenged in every one of our recruitments to hire enough staff. So that's a piece I think I want to make sure we're all paying attention to. And I think childcare becomes a key element of that, especially in jobs that are off hours. So I think Stabilization Crisis Unit is a perfect example. That's a 24-hour operation. You can go make the same amount of money at, you know, Home Depot and find childcare during the day and not be dealing with very intense situations. So I think we all are faced with some challenges with how do we recruit, retain, and support our staff. On the new or emergent opportunities, the one, and I put this on the map or the mural, is the changing nature of work. People can work anywhere now. How do we support lower educated, lower income workers? You know, do we get creative and get people technology or access to Wi-Fi, home offices? Think about our work differently to support them. You know, I think we're reading about it. You can't open the New York Times or Washington Post or social media and not hear about the changing nature of work. But I think for our agency, we now need to translate that into actually making some very different decisions. And I think partnering with philanthropy in the private sector, as some of you mentioned on the murals, is going to be something we're very interested in. We're all trying to figure it out together. And I worry most about the families we serve that don't have access to the same tools that many of us do in terms of how are they able to take advantage of remote work settings. Again, I think an opportunity is learning from families. It's something I think we all talk about, and it's challenging to do, especially in a remote environment. So we're getting ready to do a request for proposals for a firm that's experienced in consumer input. And if any other state agencies are interested in that, we're happy to engage. You know, families give input on their life, not on agencies. And so it's a nice opportunity to hear from families collectively. And I think the last piece I'd say is just back to that private sector piece. As we're all reimagining work, how can we hear from the private sector and partner with them differently on some of the challenges that we face together? And I guess I would say, you know, we have a lot of empty buildings, so there's some opportunity there for childcare. We have a pretty big footprint across the state, and that will be shrinking. So we can think creatively about that too. So I think with that, Sue, I would just open it up for questions or comments.
Wow, thanks, Lisa. Yes, Khalid.
Yeah, so I'm very interested in the family survey, and I guess my wondering is how do we provide, if the council wanted to, or members of the council wanted to provide questions to ask, garner information about childcare or other things, what would the process be? Just reaching out to you, or do you have a way to get input from other stakeholders on that?
Thanks, Kalia. Great question. Ashley Marshall on my team is going to be leading that effort, and we're very much in the early stages. So I would say the door is pretty wide open. And Angela can drop Ashley's email in the chat. She's just back from maternity leave, so she's part-time, but she's super responsive.
Thank you.
Yeah, great question, Kelly. And that's the kind of thing I think every agency is talking about, how to do that family outreach and engagement. So yeah, to the extent they can be combined, that would be great. And we'll be talking about that in our retreat tomorrow too, as you know. Peter.
Yeah, thank you, Sue. Lisa, I'm really fascinated by the direction that you're moving in terms of looking at resilience and community resilience. Just wondering, have you engaged with the folks out of Eugene? They're doing, they call it Transformational Resilience. It's the Resource Innovation Group. They have chapters all over the world now, but they really are trying to figure out, how do we do this in community? How do we prepare for disasters, and how do we live through and get back to thriving after disasters?
Oh, that sounds fabulous, Peter. We'll look into that.
I can I'll put the link to their website in the chat here.
I have one other question, if that's okay, Chair Miller.
Yeah, go right ahead.
The facilities piece. So as you know, Multnomah County had a preschool for all measure that's going to be rolling out. Facilities is an issue, but I know even in the Tri-County region, there are other counties that are looking at similar measures, and this idea of facilities is an issue. So I'm wondering, do you have some sort of map that outlines where your empty buildings are, that is user-friendly, that people could get a sense of where the buildings might be that are empty?
I was saying yes when you said map. When you said user-friendly, no, but we can get you something for sure.
Yeah, that will be a very hot topic. As you know, Lisa, I'm sure for childcare, that's just been one of the huge barriers to being able to stand any new ones up. So
well, and it's an interesting, go ahead.
No, go ahead, Lisa.
I was just going to say, it's an interesting, because the challenge for us is that we have longer term leases. So if there's a way to shift that burden somewhere else, right? Because I think the legislature and others keep asking us, oh, you went remote, where are your cost savings? Well, there's not cost savings immediately, right? So this would be a nice way to better purpose the space. So yes, Kelly, I'll definitely follow up with you.
Okay, yeah, I think that'll definitely be something people are interested in. If Katie Brooks from Bend were on this call, she'd be jumping up and down, Lisa, hearing that comment and praying that on this map, there are a bunch of them in Central Oregon and Bend. But I also know that it's not easy to convert an office space into an early childhood health and safety space. So anyway. Yes, Anne.
Well, I was just going to say on that front, you know, you all know probably the work of Western Oregon University around childcare facilities, and we've been working with them and supporting them for a few years to do small capital grants to actually upgrade and improve childcare facilities, both for revamping some of the facilities, but also to sort of help people move up the quality rating. And so there is actually, I think that as a field, we've learned a little bit about what needs to happen and how to do that. And I think that wisdom lies at Western Oregon. But I think, it's very exciting, Liesl, that you all are thinking about using your unused buildings for childcare. And I know that there are a lot of people who would want to, help figure out how to make those available at the community level. I also wanted to just talk to you about the emergency management unit. I think, like you, we have finally come to realize that, wait, every year we've been dealing with an emergency. Every year that I've been here, I've been dealing with an emergency. And so maybe rather than having ad hoc responses, we should actually have an emergency response strategy and have a unit in place and so on. And so even we internally have done the same thing. I'm very interested to hear you talk more about the pool of funding to support families. Are you talking about at the government level, there would be some kind of flexible pool response so that whatever families need, you can just do it? Or are you talking about a public-private sector partnership? Or how are you thinking about it?
Well, I'm encouraged to hear you say that. Both and. I mean, I think what we realized, and as you all have seen on the ground, it took months for us to get funding, took months for us to get funding out the door. So it was easily 6 months, and that was fast in government speak, right? Which is just not adequate for any of us. And so just trying to think creatively about how do we populate a bucket of funding that could be flexible. Maybe run through a foundation. You all are much more nimble than we are. Your contracting and procurement systems, I think, can also meet culturally specific organization needs better than public procurement rules at the moment. That's a learning for us from Jackson County. Some of the organizations on the front lines just can't navigate our systems in a timely way, and that's on us to improve, but it certainly was a miss during this response. So I'd love to continue that conversation with you and with others who are interested.
Yeah, good, okay.
Yeah, I would guess some of our other agency partners will be interested in that as well, Lisa. They all got hit hard. So, Lisa, a comment that one of our board members, Angie Blackwell, who's on the call but not feeling well today, so probably not super interactive with us, but she suggested encouraging collaboration between the foster care system and early learning providers for children in care. I've also heard in another venue the plea that the information about foster care children could be shared in schools so that schools would teachers could actually become extra support either for the foster family or for the bio family, depending on the circumstance. And I'm sure there are all sorts of confidentiality and, et cetera, issues to deal with. But not too long ago, I had a conversation with one school superintendent, and they had said they have no information about what children are in foster care. So they can't even get their teaching staff to sort of help home support for that child. So I don't know if you have any comments about how foster care can be more connected either to education and or early learning providers.
Well, I see Colt's on, so I'm going to commit that Colt and I can follow up on some potential partnerships. I know we've taken a couple runs at this, and I don't know enough, Sue, to know what our current status is, especially after the last year of events. So I'll take that as a follow-up item.
Okay, thanks, Lisa. Yeah, and we've got George sitting on the call too, and he may have information from LeGrand on how they handle foster kids.
No, I was just going to say, I'm not in the field as I once was, but when I was an assistant superintendent, it was DHS that would meet with us and talk to us about students that were in foster care, and then they would work with the principals and work with staff. So we did have two-way exchanges of information with supports. And then when foster family was struggling too, they would make sure that we were updated as well on the needs of the child. So it's kind of news to me if like superintendents probably won't know depending on the size of the district, but there will be people kind of more on the ground that should know.
Okay, thanks, George. Thank you. Okay, any other questions for Lisa or comments or anything? And anything else, Lisa, you want to add or have us think about in the next 2 days?
Thank you, Sue. I think what you said, George, is probably a good add for the next 2 days. I think we probably haven't talked enough about the hubs and how we could, as ODHS, leverage what the hubs are doing, because I think that playing a navigation connection role at the local level is something that we could probably better leverage. So love to hear some thoughts about how we can connect not just child welfare, but many of our partners at the local level to the work on the ground.
Okay, Sounds great. Lisa, thank you very much. We appreciate you being here and appreciate your staff who's supporting all of this work as well.
Great. Thank you. Have a good rest of your afternoon.
Thanks. You too. So what a segue into you, Colt. So now we'd like to welcome Colt Gill, who's the Deputy Superintendent of the Department of Education. Thank you, Colt, for making time to join us today.
Yeah, thank you, Sue. And I'll pick up where that last conversation left off too, just for a minute, because I was thinking back to what in COVID time seems like centuries ago, but it really wasn't that long ago that I was a superintendent in schools in Oregon as well, and assistant superintendent before that, like George. And in Lane County, we had multidisciplinary teams that worked across agencies to support foster students. And so there, and especially those who had the greatest needs. And so that was in place at least just a couple of years ago. And so I'm guessing that it still is in parts of the state, and maybe systemically we need to take a look at how it manifests itself in each community, and how we bring the school districts to the table and the DHS folks to the table and support. But my guess is that it is happening still in a lot of places.
Okay, great, thanks.
On my sharing with you all today, I'll use a portion of the time and open it up for discussion and answer questions as I can. And I'll start a little bit broad and then get narrower and narrower as I go forward here, just because everything we do at the Department of Education, in my mind, still is closely aligned to and ties to what happens in early learning. So at times it's a little bit hard to say, oh, I'm not going to talk about that because it doesn't matter. And to me, everything matters in this world between early learning and K-12. But I am going to try to narrow it some. As I noted in the mural space, you saw this, that we had a very strong focus on anti-racist and equity legislation going into the session. We carried several bills forward through Governor Brown's support, and we're really successful with passing that legislative portfolio, and you can see the details in there. We're heavy into engaging with partners around implementation now. We have over 90 new bills, and also trying to maintain all of our current efforts. And so that's I think we're, like everyone, navigating through COVID, working really hard on keeping our schools open to in-person instruction. And now we have these additional bills that we're also trying to implement. So engagement is more important than ever, and also a little bit trickier than ever, because everyone is so busy right now. And the communities are, working across all of our agencies, trying to ensure that all of these efforts are implemented equitably, and it's challenging for them to be in every space. And more, we need to look for ways that we can support their participation. I'd also note, sort of related to how we ended up with the focus we did on anti-racist policy development with the legislature, is related to our equity strategic plan. So a few years ago, we pushed aside a regular agency strategic plan and solely focused on what we're calling our equity strategic plan. It's framed in equity, racial equity, and anti-racist actions. It has several components to it, but it includes things like initiatives around hiring principles that have been pretty effective for us. We have now doubled the percentage of staff of color in comparison to teachers of color in Oregon. So there are about 11% teachers of color in Oregon, and we have over 20% staff of color at the Department of Education now. We are taking advantage of every new hiring opportunity through the Student Success Act and others to try to diversify our workforce so it more closely matches the student population in Oregon. And we've accomplished that with our leadership team. So our executive leadership team is more than 40% leaders of color. And that matches the racial and ethnic makeup of Oregon's K-12 student body. And we think that's really important to have those voices in that room that are frequently making decisions that impact students and families across the state. You saw the priorities that we included on the mural. They focus on engagement and services that are culturally responsive around early intervention and early childhood special education. They focus on collaboration with the Early Learning Division to develop a kindergarten assessment that is culturally responsive and supportive of the systems that it's trying to support. I'll talk more about that one in a minute. On challenge side, we're working to increase back and forth communication and collaboration between early learning and care providers and our early intervention, early childhood special education programs and school districts, so that we're supporting practices that support children and families all the way through, from early learning into higher education. And then clearly the opportunity coming forward is how we all partner to support the formation of DELC, and think carefully about all the steps along the way to ensure that that's successful, and keep all of our partners and legislators informed along the way, so that everybody has an understanding about how that will all work together. On the couple of questions open for discussion, I had a couple of ideas. I'm of course open to anything that you all would like to bring forward around how the council can play a role in implementing some of the priorities that I shared on the mural space there. But I think something for us to strongly consider is an opportunity for council and state board leadership, and then eventually the entire council and the State Board of Education, to come together around policy goals for the kindergarten assessment development. The kindergarten assessment in Oregon is, in the K-12 system, is a unique assessment. It's the only assessment that is not required by state statute or by federal rule. So it is the role of the Early Learning Council and the State Board of Education, currently just under rule from the State Board of Ed, to administer that assessment. And so we have space in their policy space where the two bodies can work together to determine what should happen next in around the kindergarten assessment. And then on your second question around what should be included in council goals, I think, again, I would speak to how it is that we bring the policy bodies together, the State Board of Education and the Early Learning Council, especially in leadership, to consider future joint meetings or discussion around House Bill 3073 for the formation of DELC and the kindergarten assessment. Those are the areas where I think we could do a lot of good work together. And I think that we have two bodies that would work closely and in partnership around making sure it's an equitable system going forward. And I'll pause there, and again, happy to answer questions or open it up for discussion soon.
Okay, thank you, Colt. Khalid.
Hi, Colt. My question is about literacy. We're seeing, and Alyssa and I were just in a conference about literacy, but there are big issues with literacy going into this year. The data has shown kids are, falling off or dropping. That doesn't include children who have different learning needs and challenges. And I feel like literacy is an issue that spans early childhood through sort of that K-3 space, given how important literacy third grade reading scores are to other things. So I'm curious if you have any strategy or plan around literacy, curriculum adoption, like something, some guidance from the department, because that's something else we hear sometimes in schools, that their teachers are needing more to support their children in literacy.
Yeah, there are a couple of things. So, clearly we have curriculum that's adopted by the State Board of Education already, and that's available for school districts to select from for their adoption processes. They can also do an independent adoption and go away from that curriculum because in Oregon, it's a local control state. So local school boards have quite a bit of authority in the curriculum that they choose. They are all required to aim that curriculum at achieving the state standards in literacy. So reading and writing and listening and speaking but they get to choose the models for curriculum and the kind of professional learning that they provide to their educators. So there's a lot of local decision making there. There are some efforts through the some of the federal funds that are coming into Oregon that the governor selects where those funds go, and we are partnering with the governor's office and Portland Public Schools and some others to look at a pilot or an exploratory model around some specific professional learning for educators in early literacy, and to ensure that they all understand all the functions that early literacy plays. We also have in Oregon, still relatively new, our dyslexia screening requirements and dyslexia support requirements that happen in all schools in Oregon. And so those are continuing to identify students that have additional literacy needs. And we will likely see more needs in the state of Oregon in the realm of early literacy. We don't have any statewide data that points to that at this time, but we do have statewide data in other areas that shows that our students do have some
when you say statewide data, you mean so you don't look at the MAP assessment and the data that has come out of that for?
Yeah, there is no statewide MAP assessment. So some districts use the MAP assessment.
Yeah.
But not across the entire state.
So what you're defining as statewide metrics are things that you administer through the state, not things that are available, not the assessments available to districts within the state that are telling a story.
Right, so each district can select, so MAP assessment is an interim assessment, sometimes used as a formative assessment as well, but those are all district choices. And so each district uses different models. So some use easy CBM testing for that. Some of them use DIBELS, some use MAP, and there are a variety of other tests. So there isn't really a way to put those all on the same scale. And again, the local control nature of Oregon, those local assessments don't roll up to the state. So the state doesn't have any ability to see what individual student assessments or a summary of those would look like across the state of Oregon. All of the state has access to our statewide summative assessments.
Yeah, I understand that. I guess, okay, so it sounds like there's not really a literacy strategy per se. I think that's what I was looking for. What I've heard is that, I mean, part of the issue is not just our children learning, the need for accelerated learning when there was a year where children were not learning at the same pace. And so keeping kids, like the rate of acceleration that's necessary and the level of intervention to get children on, at grade level and beyond is where there's a challenge. And I was just curious if there were opportunities for partnership between early learning and, your state board, I guess, to see how we have a statewide strategy to support literacy, given the year of pandemic that we've just had.
Yeah, I do think that there's space for that. And like I said, this funding through the GEAR funds, the federal funds, will help support some of that professional learning that can span early learning into K-3.
Okay. Thank you.
Peter and then George.
Thanks, Sue. So Colt, this is Pat Allen joined us, which is great. I just want to make sure, and I'm sure you guys are already doing this, but with the new mandates that CCOs have now towards kindergarten readiness, I'm hoping these efforts are aligned between ODE and OHA. So, and I'm sure you're taking a lot of community input as well on that. So just want to make sure.
Yeah, thank you. Yeah, we frankly, we really appreciate that transition with CCOs, and they from the beginning they have included things like you have done a lot of work with in Southern Oregon around social emotional well-being and supporting attendance in schools and avoiding risky behavior. Those kinds of things have always been a part of that partnership between education and CCOs, and has led to things like the good behavior game that you all have rolled out. I do think that going forward, just continue to look for more partnership there. And these kindergarten measures are another opportunity for us to strengthen that. I'd let Pat talk to it, of course, as well. But a high number of our students in the K-12 system and early learning system are members of CCOs and they get services. So it's great to have those ties where the population is.
Yeah, great, great question. And I'm sure Pat will be talking about CCOs shortly. George.
Just some quick feedback, and just in case I don't get to always say this very publicly, but I'm crazy about Colt Gill. So to me, there's not a better leader in education than Colt, and I'm just always thankful for his leadership and his demeanor. Colt, some thoughts that I had in what you were sharing is, for me, the kinder, readiness part of the kinder assessment part, really important for our K-1-2 teachers, but especially our kinder and first grade teachers. And then the transition back and forth, the information that we get, whether it's to the family or to early learning care providers or Head Starts, all of that is really supportive of the work that we wind up doing in kindergarten to support our children. The other part with that, with early childhood intervention and transition services that we do, that definitely is the right kind of work that we need to get better at in sharing of information, especially as we transfer service plans into an IEP, if we do that. The other part that I think that went well this year, that I don't know if it's going to be brought up, but whatever happened with food and DHS and ODE and students having their food needs met more often away from school over the summertime or even during the school year, there's a lot of work that took place this last year that I feel has been really beneficial for a lot of families. So I didn't see that listed in anything, not yet at least, but that's probably one of the most impactful things that you guys have done. And I don't even know if you guys are even thinking about it, because it met, it filled the gap for a lot of families and a lot of children. And the other part was, I do feel, and I think you've heard this side of me, Colt, many times, the mental health, the behavioral health, the regulation, the social emotional, all those things for K-1, like we are getting kids, not just K-1 that are a year and a half, 2 years behind, a year behind, whether reading, whether math, or whether behaviorally, they're not regulated. They don't have routines down. Their stamina is low. Their resilience is low. We've got things that's not really listed in here, but the behavioral part, the mental health part, the wellness part, the regulation part, even for our teachers and the people that are going to be working with these kids that do work with these kids that are getting burnt out, like whatever we can do to, I don't know, whether it's adding staff or whether it's trainings or whether it's just a resilience mindset for PD for them, we've got a lot of work to do. Especially, for me on the education side, and you've heard this side of me, but whatever we do with kinder and first grade and early learning, I think there's an element there that needs to really be explored, and then attack the gaps with funding and with resources. Thank you.
Yeah, thank you, George. A lot of really good points there. The additional access to nutrition services, food, and other services, both in school and out of school, has really come from both the teams at DHS and ODE, digging into every possible federal waiver and resource and putting those together to create those opportunities. And I know that they're continuing to push on our federal partners to extend those beyond COVID-19 emergency times, as we found a lot of them really made a big difference for our families. So we will continue to push on that and make that available to the greatest degree we can. I would say that you're right, and I left out all the efforts and work around social emotional learning standards and having a culturally responsive approach to that. So under House Bill 2166, that's the Racial Justice Council bill that went forward in the education sector. It has an entire section supporting the development of social emotional learning standards. We have been doing that work long time in partnership with ELD through the early learning and kindergarten guidelines. There's an entire section on early learning and for kindergarten social emotional learning standards. We're going to be building on that in partnership with a framework we developed with the Oregon Health Authority around taking a culturally responsive approach to strengths-based resiliency building social emotional learning. And so that will, I think, assist George, with what you're talking about, support for our youngest learners as they come in, and building those skills for them and providing them the supports they need. We did see from the school year 2019-20 school year to the 2021 school year, a 10% increase in the number of school counselors, mental health specialists, and school psychologists. So this is a lot to do with the investments from the Student Success Act and the Student Investment Account that has a focus in that area, as well as the high school success work that's been going on in Oregon. And I think that now with COVID happening in our schools and some of the other challenges that we've faced around all the inequities and the wildfires and the heat wave, I can go on and on, some of the challenges that many of our communities have faced. There's a need for even more. So a 10% increase was a good start, and we need more, and we need more mental health specialists to look and like the students they're serving and speak the same languages as students and families they're serving. And so that's the effort that we have going on now.
Yeah, it's huge. Workforce is just so huge for every single agency beyond those represented here, but everybody is obviously in a dire need. All right, we need to move on. Colt, thank you very much for your comments and your presence today, but also thank you for the work that you're doing. And I appreciate George's endorsement of you as their deputy superintendent. I think we'll all second that. So we're going to switch the order now. Thank you, Alyssa, for being able to be flexible. And Pat, since you are on the line and we've got some of your staff and policy advisor with us, how about if we just switch to you now, Pat? And thank you for being here. It's really good to see you out of the press conferences for a change.
It's good to be out of the press conferences for a change. Thanks for the opportunity to provide a little bit of an update, and I get to assure you that an unnamed novel coronavirus in this update. It's a new habit I'm trying to forge. We'll see if I can stick with that. What I wanted to do is following the questions that you all provided, start by talking a little bit about the priority work around that we're doing around Raise Up Oregon, and what the top priorities for us are for the next 2 years. We've got 4 of them. I think first and foremost, it's really the Universal Home Visiting Program. It's really about anchoring and scaling it in the current early adopter communities. One of the things we've noticed is a pandemic makes everything kind of worse, right? And so we've had some real challenges in trying to roll this out. We've had challenges with commercial insurance coverage that slowed the ramp up across communities. But there are services that are currently available in subsets of Lynn, Benton, Lincoln, Marion, Washington, Deschutes, Crook, and Jefferson counties. And so scaling up really tries to follow the Fidelity model guidelines and be able to expand those services across not just subsets, but all of those communities. And also contracting with commercial health plans right now is on pause while we're trying to work to establish a consultant to help us through those negotiations. And I apologize, I'm having carpet installed right outside my office door, so if you hear strange poundings or other noises, there's nothing wrong. That's really I think the number one focus is universally offered home visiting. But I think the next topic that's huge for the agency, but I think also important for ELC, is our 1115 Medicaid waiver renewal. We're in the midst of developing the policy principles that will inform that. And actually, Chair Miller and I have had a conversation about organizing a more in-depth briefing about the waiver for the council, because I think there's a lot in here that's useful to know about. First and foremost, we're reframing the waiver to really elevate health equity and address social determinants of health. And that's especially the case while people are navigating multiple systems or transitioning between settings. If you think about healthcare in Oregon, it's not sort of a single system, it's really a continuum, and there are gaps in that continuum, and people find themselves in those gaps, and they're painful for the people who are in the gaps, And because when they're in those gaps, they're not getting access to preventive health care and social determinants and those kinds of things. They're expensive for the rest of us, because when people tend to emerge from those gaps, it's when they're sicker and poorer and need more help. And we could have avoided that had we smoothed those gaps. So that becomes a big element of what we're trying to accomplish. We've got some specific opportunities around child and family health, including a request to provide uninterrupted coverage to children up until age 6. So basically half of all kids in Oregon are born onto Medicaid. Let's keep them on the Oregon Health Plan until they reach age 6 so that they don't fall into those transitional spots. And then the other thing we've learned through the pandemic, there's been a nationwide suspension in what we call redetermination of eligibility, going back and seeing if you're still allowed to be on Medicaid. And what we've gotten really good at in Oregon is kicking eligible people off the Oregon Health Plan because they don't read their mail. In kind of an oversimplification of the circumstance. We think that the about 1.3 million people who are now on the Oregon Health Plan is actually pretty close to who's eligible for the Oregon Health Plan. And we've had a big problem of eligible people churning on and off the system at personal cost to them and at great cost to us. So 2 years of continuous eligibility for everybody from age 6 on up would be a step to try to eliminate as much of that churn as we possibly can. We also want to retain health benefits for youth who are entering the juvenile correction system. This is this notion of transitions where we've got lots of categorization where you end up by law or rule getting kicked off healthcare, and it's incredibly disruptive, especially in short-term settings like local jails. And the focus for kids is really around youth corrections and how we can try to not have that linkage be broken. We want to retain child eligibility levels and benefit packages for youth with special healthcare needs up to age 26. Again, trying to extend the ability to maintain that coverage, and a bunch of other things that we'll want to talk about in more detail when we come back and talk about the 1115 waiver. The third priority area I would say is vaccinations of children for the unnamed novel coronavirus that I promised I wasn't going to talk about. We anticipate that eligibility to be finalized sometime mid next week, I would say, and we're ready to roll out that vaccination. One of the challenges we're gonna face is unlike at the rollout of vaccines to begin with, the good unlike is we don't have nearly the supply constraints that we had at the beginning. There are ample doses now of all kinds of primary doses for adults, of boosters, and now kid doses that we've just completed our ordering for. So that won't be the challenge. Now the challenge is the systems that we use to get shots in arms are completely overwhelmed and overtaxed by dealing with the surge, either because they're local public health trying to keep up with all the things that they do around managing the outbreak, hospitals and health systems that are all overwhelmed, and they're all busy trying to get boosters into particularly seniors that especially need them. And we're still working hard to continue to close the equity gap of the vaccination rates between communities of color and the white population. We've closed it by about 50%. Since April, which I think is really good progress, but that still leaves us pretty far short of actual parity. So trying to do all these things at the same time and then roll out pediatric doses is going to tax the systems that we have. Right now, your best sources for vaccination for kids are going to be pediatricians, family practice offices, and local pharmacies. And vaccine is being provided to all those locations. And then the fourth priority, and Colt touched on it a little bit, is continue to work on the development of the health aspects of kindergarten readiness and children's social emotional metrics. This is really, really critical work as we think not only about, we think about that as a metric, but think about the huge interplay and relationship between education and healthcare, and the work that we're trying to do in the agency to really maximize the benefit of huge amounts of healthcare and behavioral health investment that's flowing into both the education system as well as the health system. We've talked about that a little bit, I know, previously. You asked about challenges and barriers to the things that we're trying to accomplish. And again, the unnamed novel coronavirus makes everything worse and slower and harder to do and harder to think about. I'm encouraged to think that maybe things might be getting better. And every time I say something like that, I feel like I'm tempting the gods. So I don't want to go too far down that path. But we really do. We're approaching 80% of adults vaccinated in the state. We're going to have kids that are going to be eligible. We're down to about a quarter of the population that is vulnerable to infection. That's still pretty high, which explains why we're not down around the bottom of infections like we used to be. But it becomes a barrier to trying to get all this other work done. Another big development is the decision we and our local partners made and informed CMS of to suspend work on the Integrated Care for Kids grant. As we worked through that process, it became really clear that the grant program as designed, without the willingness of CMS to make some pretty fundamental changes in how it wanted to administer that grant, was going to be impossible to be able to successfully pull off. And so over the summer and fall, the Oregon team, which is us plus the Pediatric Improvement Partnership and Pacific Source collectively, decided that our efforts were really better put elsewhere. I think the change in administration maybe caused some different perspective about the value of that grant, and so we're not moving forward with that application. You asked about new and emergent opportunities, and I would say there are three to talk about. One is the ongoing need to focus on behavioral and mental health across the lifespan. The behavioral health system across the state is under extreme stress. It was under extreme stress before the pandemic. The pandemic has made all of that worse. In many respects, that's not different than any other element of healthcare or almost any other industry. But I think we've got some. I know that we've got some really critical challenges that we're working to address with things like staff retention bonuses across the behavioral health system and that sort of thing. That still leaves us with a historic opportunity from the Student Investment Act to make investments that we've never ever been able to make before in children's behavioral health in a school setting, whether through school-based health centers or in schools. Colt talked about the hiring counselors and behavioral health specialists and those kinds of things. We've never had that capacity before, and so we really need to be able to get through the crisis element into focusing on how to maximize that benefit. Then a small thing from a technical standpoint, but a big deal thing from a coverage standpoint. We've been able to establish that we don't need any special waiver or permission. We've got the existing authority to extend Oregon Health Plan postpartum coverage for people who gave birth from the current 2 months to a full 12 months of coverage. And we're working to implement that, and that should end up being in place by April of next year. And just a couple of cleanup points to make, and then be happy to have some conversation. As we move forward in the creation of the Department of Early Learning, I think there's been some conversation that I think has been settled now, but I just want to reinforce, hopefully, where it's been settled is that employment-related daycare benefits absolutely belong with the council, but I really encourage people to not think in terms of moving the eligibility determination out of the one system. I think we've actually achieved something really monumental with a nearly $400 million investment in trying to do what's been a long-term vision in Oregon, which is consolidate eligibility determinations and not have different systems making different decisions and subject to different risks. That system now works, and I would really strongly prefer to see us add to it rather than take away from it. And like I say, I think that's a decision that's been made, but I just wanted to reinforce that. I already talked about the waiver, and I'd like to come back with our team and spend a little bit more time on what's in the waiver and what our approach is to that. Talked about the social and emotional metrics. I think it's important that ELC watch the work that we and ODE and others are doing in that area to make sure that we're on target and not heading in different directions and not doing what agencies can do and kind of getting in their own silos. I think the council's got a unique perspective to be able to do that. And then I guess just the last thing, and maybe again, this is my wishful thinking as we hopefully come out of the pandemic. I know you're talking about a monthly half-day meeting potentially as a pacing, and I'd like to get back to a place where I was 2 years ago, where I was coming to all of every meeting. And the reason for that is because that time lines up completely with my priorities and OHA's priorities in terms of kids and kids' health and how we can contribute to the success of kids in Oregon. So cross your fingers. Hopefully we can get to that point. But I completely support that kind of a schedule and want to commit to it as much as I can. With that, I know we've only got a few minutes left. Be happy to answer questions or hear input or anything like that.
Thank you, Pat. And thank you also for your willingness to have our monthly meetings on your calendar if nothing else kicks them off. So thanks. Questions, and I think I'm correct, Alyssa, that we can run a little bit over with Colt if you've got the flexibility in your schedule.
Not according to Remy in the chat, but I have flexibility, yes.
Okay.
I can be flexible, yes.
And David can be too, I'm sure. Okay, let's go. Peter.
Thanks, Sue. Pat, is there discussion going on, serious discussion about a public option on the Oregon Health Exchange? Because that could be a godsend for early childhood folks if workers could get health care, affordable health care on the exchange.
Yes, so there is. We're required by the legislature to bring back a plan for a public option. The interesting question that we're going to work through as we do that plan is, what is exactly the problem that we're trying to solve with a public option? Because what we've discovered is public option means different things to different people and kind of spans the universe of what we're trying to fix with that. We have right now on the Oregon Health Plan, without there being a public option, very low cost plans that have low deductibles, low copays, highly subsidized premiums. And so the question is, well, is it that those stop too soon and we need to expand those benefits? That's one possibility. Is it that we want to be able to deliver state general fund investment into healthcare subsidies, and that would be a way to do it? That's another possibility. There are several others, but I think being clear about what are we trying to accomplish with the public option is a piece of the conversation that we need to land as we make that proposal.
Great, and I'd love to see the Oregon Health Plan as a public option. I mean, because the Oregon Health Plan is a great plan.
It is.
Okay. Thanks, Peter. Other questions of Pat? George?
It was just kind of a quick random thought that I put in there. I don't know if it's that random though, but I put the middle school student-based health center, and we definitely have those at high schools at some locations, not very often in any middle schools, but then it just came as early learning, and if anything that ever happens with early learning, whether Head Starts or big preschools, and having nurses or having counselors or therapists in those settings, and getting to that level of, I'll just say system-wide, statewide system of support, that would be a great goal down the road.
Yeah, that's a great idea. And there are some kind of happenstance versions of that out there where you've got a high school that's got a health center and you've got childcare offered in that high school, but being more intentional about it, I think, is really interesting and worth exploring.
Yeah,
really.
Good question, George. Khalid.
Actually, I have more of a comment, but I just want to applaud Patrick for the work that OHA has done. I know Children's Institute has been involved in this too, around the social emotional health metric. It is a small thing, but it's a huge thing. Like you mentioned it, like, oh, we have this health metric that is like transformative, and we're leading the way nationally in this work to do preventative work to connect children early with measures that support and their families that support them. So I just, applaud that. I'm very excited by that and the opportunity it provides us in the early learning space to really connect children and families with what they need to support their children thriving. So
thank you. Support. Thank you.
Yeah, great comment.
I was actually going to say the same thing, and I just think it's such an interesting example of how systems change can happen, because there was a pilot in Douglas County, and the Children's Institute was really involved, and the OHA was really paying attention. I just think it's a great victory. I totally agree with Pat and with Patrick and Kali about that, but also there's a lesson there, I think, in how we can make change happen through this collaborative and sort of very strategic way of thinking about how we institute a priority that cuts across so many different departments and agencies and really urgent community needs. So I just want to applaud you also.
Thank you.
Yeah, you know, it's interesting. It sort of brings up the whole issue that many of you have talked about in our conversations about, you know, how can we keep track of what's going on around the state in different regions and these wins and these models and pilots that are being successful. How can we share that information so that others in the state can learn from it? I think that's something certainly the council could play a role in that. In fact, we talked about that a little bit on an early learning division leadership call the other day. So I think lots to learn from one another. Pat, just a quick question. Do you see any way that the council or our early learning hubs can support the home visiting rollout in your pilots? Or maybe they already are and I'm just not aware of it.
Yeah, that's a great question that I might pitch to Kate Wilcox, who's probably a little bit closer to that than I am, to see if she's got any thoughts on that.
Sorry, I was typing something else. Can you repeat the question?
Role for the council and early learning hubs on the further rollout of universal home visiting.
Yeah, so the pilots are really, it's a great early adopter community, because some of the communities are 100% local public health. Others are have a dual function. So the function of the creating and maintaining that system of care is under the hub, and then the services are provided by the local public health nurses. And so we're learning a lot about that relationship and how to connect the two, and some are really connecting well and others are struggling because of lots of different reasons that we're working through. One of our visions is helping to make at the local level the resourcing of the entire community sustainable through reimbursements of the services. And so building in that work that the early learning hubs do into the service reimbursement. And so you create that connection and that collaboration of the hubs and the service providers. So lots of learning that we're still doing, and we're still pretty early in all of this. A lot due to the pause that we've had to take because of that variant that will be named unmentioned. And so, but we've got some really nice opportunities. Central Oregon is one that's looking a little different than the Marion Polk community, that's looking a little bit different than the Lynn Benton Lincoln. And all three of those communities have as their community lead the early learning hub. So it's exciting, it's challenging. And, you know, every single one of those communities has their own culture and way of doing things. So, so it's fun and lots to learn. So.
Okay, thank you, Kate. I think it's something council members we can just keep in mind as we look at, you know, what we might do next year, as far as whether there would be a role for us to play in getting more informed about those pilots. Okay, Pat, thank you as always for being a part of this, and thank you to your agency folks who are on this call as well.
You're welcome. Thank you.
And you are welcome to stay.
Planned for a while.
Great, thanks. So, Alyssa, I've got a question for you. I think I see Margaret on here, at least she was. Margaret is on here. Do you mind if we jump to Margaret and then jump back to you?
Oh yeah, no problem.
I know we have Alyssa for the whole day, I'm sure. So, so thank you, Alyssa. I appreciate that. And Margaret, welcome. It's good to see you again. Thanks for being with us.
Thank you so much. Hi, Sue. Hi, fellow directors. Hello, council members. It's good to see all of you. And I think you were looking for just some updates. I know we had put some information on the to answer some of the questions and trends. And so if it's helpful, I'll just kind of back up and give you a sense of where some things are and then flag a few items for potential collaboration, if that sounds right.
Right, that's perfect.
So OHCS historically had been a relatively small housing finance agency with a small arm of kind of the community services work that we do, the homeless prevention work and energy work. I think you're all aware that we have been asked to really step up into the crisis response and recovery like never before. Our agency will be doubling in size at the end of the biennium from the prior biennium. So we're in a huge growth and expansion phase. And a lot of that is because of short-term crisis response and recovery work that we're doing. Rental assistance has been a big focus in the news. And so I wanted to take a moment to give you an update on that. We have provided approximately $300 million of funds that have been paid out to landlords in 10 months. And just to give you some sense of scale, in a typical year, we pay out $17 million. So it is a huge amount of resources that has gone out the door. We're partnering with local community action agencies to do that. And we've brought in outside help and vendors to help with that effort as well. Our program has taken a lot of heat. We are ranked number 6 nationally. So that's an important context for folks to understand. In the last 2 weeks, we've paid out more rental assistance than we did in all of 2019. But a lot of folks are still waiting for assistance. And a lot of what you're hearing about right now is the potential for a legislative negotiation. Folks are calling for a special session because there are about 11,000 people who have applied for rental assistance and have been waiting more than 60 days for that assistance, which means that their eviction protections are wearing off. That is really concentrated in the Portland metro area. It is a metro area crisis that is not affecting the most of the rest of the state. There may be outliers here and there, but it really is concentrated in the metro area. So we're working with our partners to do everything we can around eviction prevention work and expediting the processing of those requests for assistance. But I just wanted to make sure you all had that context, because I know this is in the, if you're like me, you're not used to seeing your name in the newspaper every day. So I know Pat's used to that now, but some of us are new to that world. So I just want to make sure you have that information. Yeah, Pat, feel free to, I can send them your way. I want to make light of this. There is a lot of concern and
where do you think they got to you from?
Nice of you guys to share.
We share the love. We share the love. Actually, all joking aside, we are partnering with the Oregon Health Authority. We went in together on a funding package from a network of grantees that OHA funded to do outreach work for COVID response. So everything from contact tracing to kind of community engagement around vaccinations. That's a network of community-based organizations that have reach into Oregon's diverse communities. And we partnered with Pat's staff to add funding for those organizations to do outreach for folks that are doing rental assistance applications. And so we're really, really grateful for the partnership that we have with OHA on that outreach effort. I would be coming here saying we would love your help to spread the word about rental assistance, but we're actually pretty much fully subscribed for this program. We have the dollars to pay out all the applications that have come in, but we don't actually have enough dollars to continue receiving applications. So we'll be making some decisions soon about closing down application intake because we are fully subscribed for that federal program, which just shows how insatiable the need is for rental assistance. This is really about the crisis in housing that we had pre-COVID. I know this is a common theme, right, for you all, of these systemic issues that you're working on. We had too many people that were housing insecure before COVID, and COVID just exacerbated this need. And now we've just got this incredible demand coming in the door. And so, that will continue to roll forward. If you have questions about what's going on with this program, feel free to reach out at any time. I know there's a lot of information flying around and a lot of folks trying to make sense of the situation. So we'd be glad to work with you. We do regular media briefings on this. I did want to just call out that as we are looking at the program being oversubscribed and having to make decisions about who gets funded, we have a prioritization schema in place, and we are prioritizing families with children. We can't say that because of fair housing rules, but it's household size, because we know that families with children and larger households tend to be more vulnerable to housing insecurity and homelessness. And so that is built into our prioritization. So I just wanted to make sure that you all were aware of that. as we continue our work in crisis response, we're about to turn our attention to mortgage assistance. That's the next wave of work that we'll be launching. This is another federal program, the Housing Assistance Fund. And this is to provide assistance for folks to pay their mortgages. We will be launching this a little bit more quietly and getting referrals from servicers and community-based organizations so that we can try to triage and get those folks that are at risk of foreclosure first. And so rather than kind of opening a large portal for the whole state, we'll be doing this through referrals. So one of the things I talked with Sue about is, as we start accepting applications, this will be mid-November that we'll be accepting those applications, and we'll get you more details on that. We would love to work with the early learning hubs to try to make sure folks have that information and know where to go and can access this resource and kind of find out how to get involved in that in multiple languages. In addition to rental assistance and mortgage assistance, we're also running utility assistance programs and a brand new water assistance program that's also part of the federal package. So that work is also going on in the background. And then we continue to lean into our role for wildfire recovery. There's a $150 million package that we got from the legislature on rebuilding housing and replacing manufactured homes that were lost in the wildfires. And then we also, within the next few weeks, we'll learn from HUD our allocation of community development block grant disaster recovery funds, which will be anywhere from $30 to $150 million for sticks and bricks money for rebuilding as well. So that's another part of our work. One of the things, though, that we haven't lost sight of is that while we're running these crisis response programs, we're also looking long-term at how we can make decisions today that will lead to the long-term equitable recovery, building out of the wildfires and the COVID crisis. And so a couple of things that we've talked about with you before. One is we got considerable capital money from the legislature in the 21-23 budget. Our budget is $900 million, which is double what it was 2 years ago. And that doesn't include all of the federal bonds and everything else. But that includes $500 million of sticks and bricks capital for affordable housing development and preservation. It's double what we got in the prior biennium. And a lot of that is slated for the LIFT program, which is family housing, as well as permanent supportive housing, which is a partnership that we have with Pat and his team at OHA to include services for folks that are at risk of homelessness or have been experiencing chronic homelessness or severe and persistent mental illness, which also includes families. And so there's a huge opportunity here to continue partnering with you all on how we can harness that opportunity if we're building those homes that are, large bedroom size homes. How do we do that in a way that helps you meet your goals? So we want to make sure that we're at the table working with you on that. And then we received $10 million for, and we've been working with David Mandel on this, for co-location of early learning facilities and affordable housing, which of course is a conversation that we started a couple of years ago. It's pre-COVID. And now we have dollars for that. And that's exciting. And we're planning to partner with the Low Income Investment Fund, which is a nonprofit organization based in San Francisco that does a ton of policy work around co-location of early learning facilities. And they also are a funder of early learning facilities. And so they are planning to work with us and to engage you in that conversation as well in a legislative report that is due back in the short session in February around how we will deploy that $10 million for early learning and affordable housing co-location. That's great. We obviously are very, very capacity constrained. So having that outside help from the Low Income Investment Fund will be extremely, extremely helpful for us. So we're keeping our eyes focused on all of these development programs. And then I just did want to mention that we have another resource, which is a long-term rental assistance program that the state funded for at-risk youth. And the idea here is this is for youth that are experiencing homelessness or aging out of foster care. And again, there could be some crossover with some of the goals, especially if we have pregnant or parenting teens that we need to think about housing with those resources as well. I did not talk specifically about homeownership, except for the mortgage assistance program, but I will say that one of the other things that was really exciting about this package was its emphasis on homeownership. We know that if we can help, there are a lot of renters who could afford a mortgage, but they can't afford a down payment. So if we can help folks to get out of rental housing, not only do we set that family up for success and generational wealth building, but we also help free up that rental unit to create an opportunity for the next family. And so we were thrilled to get resources for down payment assistance to pair with our mortgage lending products, resources for home ownership development for the first time in some flexible ways. And this was all informed by the Governor's Racial Justice Council to have a specific lens around engaging culturally specific developers to bring alternative models of housing development to the table to help build wealth and housing stability for generations. So that's the quick rundown. Certainly engaging on outreach with these crisis response programs is a place we'd love to work with you. And then also thinking about, again, as we build out this long-term housing infrastructure, which will be there for future generations, how do we do that in a way that has in mind your broader goals, and we can make some smart strategic decisions today that will be helpful as we move into the future.
Wow, Margaret, doubling the size of an agency within a 2-year period is mind-blowing, remarkable, terrifying. So Alyssa may want to
all of those things.
all of those, the above. Wow. Questions and comments for Margaret?
Yeah, Margaret, that was great. Thank you so much. And it is impressive. But the capacity issue on the ground is huge. And so, I mean, and I appreciate, LIF, the low income, investment fund and others, but there's still, you just need capacity on the ground to be able to do this. And I'm wondering how your sort of nonprofit partners, how that whole industry is doing, and who else you're sort of being able to partner with on the ground.
Yeah, thank you for that question, Anne. I really do appreciate that. And I think if I could do, we've all learned a lot collectively in the last year and a half. I think if I could do something differently, there are a number of things. But one of the things I would have done is I think I would have early on recognized that the lift that we're asking our locals to do, our local nonprofit organizations, is just it's not a good, it's just not the right fit. It's not a reasonable ask for these small organizations. We need their expertise, we need their vision, we need their knowledge. But I think about what's going on in Southern Oregon, and I can't recall if we have folks on this call from Jackson County. Peter, absolutely. So, Access is a great example. They're a community action agency. They do great work. They've got a great new executive director, but we're asking them to help house wildfire survivors and place wildfire survivors, run this emergency rental assistance program, run utility assistance programs. And that's just what we're asking them to do. It's too much. And so I think what I would have acknowledged earlier, if I had understood it, was getting some big disaster firms in, vetting them carefully, making sure they share our values, but to help with the lift of some of these programs, because the efficiency that they can bring to some of the things that aren't client facing, to just get payments out the door and kind of get things organized would have been really helpful. It's a little late to be changing course now, but there are still some programs that haven't fully launched. So the nonprofits are absolutely stretched, and I think are being asked to do probably too many things all at once. And there's so many examples where we're talking about eviction prevention right now, and there's a lot of great ideas out there about, can't we cut checks in the courthouse, and can't we look people up as they have on the docket if they have a judgment filed against them, and find them in the queue and expedite their payment. These are all great ideas, and we can't find nonprofits who are willing and able to do it right now. And so it's like we're all having to rethink the regular course of doing business. I think that the good news on the development side is that every time we've put out affordable housing development dollars, I've been worried that we won't be able to spend them because the industry won't be ready. And I've been pleasantly surprised every time. So I'm hopeful that on the development front, we have folks that are ready to go with these resources, but we're also going to be leaning on folks from the federal government to help provide technical assistance as well with some of these federal programs.
Are any of those dollars just basic capacity building dollars so that those local organizations can expand and be able to have the capacity to take this on?
Not really. The federal programs have a small administrative cut. So for example, this rental assistance program is 10% administrative cut. We only kept 1% of it and passed the rest on to our local partners. We've blown our 1% out of the water. I mean, we're basically throwing money at this program. So no, there's not a lot of capacity building resource out there. The federal funds are very tightly controlled.
Other comments, Peter?
Margaret, I don't know if you're on when Lisa was giving the ODHS update, but she talked about that they have an emergency management team now. And I'm just assuming that they're in communication with you for the next disaster, the lessons learned, and also just to prepare ourselves so that we can respond in a more efficient manner.
Peter, I appreciate that. And I'm so glad that Lisa will talk that through. And I think we've all been humbled by this. This is, we had one half-time person working on, disaster preparedness before COVID hit. And that's not the case now. but I think it's been constant. Pat, I'm sure it's just been constant changing, growing, retooling, rethinking. And so it's not that we've got it dialed in now. I think it continues to evolve. It continues to evolve. And now we're at a different stage of this. So that's been interesting where now we have new resource. And so we have to figure out how to deploy it effectively. And, this will have a long tail. So our programs will have a long tail, through the next 2 years as we deploy all these recovery type dollars.
Absolutely.
Yeah. George.
Hi, Margaret.
Hi.
Hey, kind of a weird question, but somewhat of a rural location. Infrastructure is a huge thing for smaller towns. They don't have the machines. They don't have as much resources to move dirt, to put in roads, to put in sidewalks, to put in electrical grid systems or sewer systems. And then you can't develop that land. And somebody buys the land for $300,000 and to move the dirt on the land to make it so that you can have housing, and whether affordable care units, whatever it might be. What does the state ever do for locations that are a little more rural that may want to add facilities or expand and have more, I'll just say, apartment living complexes or affordable housing units, but the developer doesn't have the funding for infrastructure and the city doesn't have resources for infrastructure? And do you ever fill the gap with funds so cities can do more for infrastructure so that developers can make decisions to put in affordable housing?
Yeah, it's such a great question, because what ends up happening, as you know, is without those dollars available, cities and local governments put on system development charges that add to the cost of developing housing. And then everyone says, why does it cost so much to develop housing? And we did an analysis of this a couple of years ago at the request of the legislature, and the system development charges have just exponentially increased over time. But it's exactly for the reasons that you're saying. Those local jurisdictions need to raise those dollars from somewhere to be able to build out the infrastructure. So it's a really challenging piece because it's sort of a hidden cost then of housing development. I will say that our friends at Business Oregon do a great job. They have the Infrastructure Finance Authority, and they also have the Special Public Works Fund that they administer. They also administer the regular Community Development Block Grant Program, which has infrastructure as part of its emphasis, and local governments can apply for those funds. what we have not dialed in as a state, and we were working on this through the Regional Solutions Cabinet pre-COVID, and then everything changed. But what we haven't dialed in yet is to figure out a systemic response interagency between housing, transportation, so ODOT, Business Oregon, and land use to work together to say, we'd like to build affordable family housing with a co-located, early learning facility in this town. How do we back up and build out infrastructure, roads, housing development, and kind of land use overlay so that we can all get there together? And then how can we get that local government ready with the capacity building dollars to be able to make this happen? That was a dream. That was a sparkle in our eye, for several years. We were working toward that. We had some pilots, the workforce housing pilots that the governor put together to try to get at this issue. And then with COVID, we just had to back away from that. But I share that vision, and I hope we can revisit that.
I was like music to my ears just listening to you. And Sue, if we ever do decide to have a goal such as what was just shared for expansion for rural areas, I would be on that committee. I mean, anyway, I do think that infrastructure part is a big deal, and we got to figure that out.
Awesome. Thank you, George. We will add that to the priority list, which is going to be
getting too long, right?
It's getting long, but that's good. That's good. We might as well have some challenges.
But we're looking, the feds are talking about infrastructure. We'll see.
Yes, fingers crossed. Oh my gosh. Margaret, thank you very much for being with us today, and also for all of the amazing work and leadership you're providing in the state. We appreciate you a lot.
Thank you all. This is always such a wonderful place to engage, because you have the big vision and you don't ever lose sight of that. And we need more of that around these days. So I appreciate that.
All right, thanks. And now, Alyssa, thank you for your patience and for joining us for today and tomorrow. And we are rather excited to hear about what's going on in the early learning division.
Thanks, Sue. It's just exciting to go after everybody and hear all of the work. I was taking notes like, oh, this would be cool to partner on, and we should talk more about that. So just echo Margaret's appreciation. This is such a great space to think creatively and really capitalize on some opportunities across our agencies. So I'm going to try to walk through our priorities and our work kind of in two buckets. So there's sort of what are we on the hook for coming out of this legislative session as we're building the Department of Early Learning and Care? And then what are some of the more aspirational bodies of work as we, hear what each other is doing and can really try to build on those opportunities. So thinking about kind of the work of Raise Up Oregon and our priorities right now. Things, of course, had gotten a little bit waylaid in terms of implementing the Student Success Act early learning account initiatives, like professional learning, for example. We also, of course, saw a difference in how Preschool Promise and OPK Head Start were delivered during the pandemic. So really focusing on making sure those programs have support as children are returning to in-person instruction, supporting the workforce and supporting the families utilizing those services. We also, of course, are on the hook to come back to legislature in February with an update on our readiness and community readiness to support program expansion, particularly for Preschool Promise, and making sure that we're able to hold quality at the center of that work, and really making sure that that while quantity is incredibly important, especially coming out of this pandemic or moving through this pandemic, but keeping quality at that center. Related to that, you all know of Spark. It's sort of been another one of those bodies of work that's been put on hold. But if we're going to continue expanding access to programming, we all have to have a really, really concrete understanding of what we mean by quality. I think Liesel's suggestion of how we might be able to use state office space is really exciting and could be a really great opportunity as we define quality using looking at quality environments and how that overlays with different types of spaces. We're also expanding coordinated enrollment. So this was sort of piloted with Preschool Promise, but is intended to be expanded across multiple early learning programs. So this really is an opportunity to strengthen our coordination and alignment across our publicly funded early care and education programs. To Pat's comment, our goal is to stay within the one eligibility system, and our dream would be to see programs like Preschool Promise and OPK Head Start added to that down the road. So one of the things we're working on now is how could that plug into coordinated enrollment? What does that work look like alongside one another? We're also building our professional learning system for the early care and education workforce. I know we're all struggling with workforce issues in our various sectors. And like so many of the similar barriers, we know that our providers are not being paid what they should be to make a living wage, to recognize and compensate them for their knowledge and expertise and skill set in this field. So working on developing a pathway to grow our existing workforce, strengthen that workforce, and increase recruitment and retention efforts across our other, across the early learning sector, and building that capacity long term. You've also heard about the licensing rule revisions that we're doing. This is going to be about a 2-year process, but we're really excited about the opportunity to look at our licensing rules next to national best practice standards, and redesign these rules in a way that are much more accessible, plain language, can really be informed by equity at the center, and helping to increase access to licensure and funding down the road as well. As Colt mentioned, we're also really excited to get this kindergarten assessment revision work underway, and how we can really look at ways that it can be used to help us learn more on the early learning side of things, since we don't have a universally offered early learning system, right? Kindergarten is really our first touch point to figure out kind of where our children are, what they've been experiencing, and how we can support them. So that, along with the early learning and kindergarten guidelines revisions, and as Colt mentioned, the work of mental health and social emotional learning, I'm really excited to kind of expand those bodies of work across our teams. I think generally speaking, the challenges and barriers fall into the internal and external categories. So internally, we are all feeling the pinch of procurement and human resource barriers. A lot of positions were approved this legislative session that hadn't gone through HR. So now everybody's in this kind of crush at the back end of getting positions reviewed and approved and posted. We were dealing with some considerable backlogs through the background check requirements that our early learning division staff are subject to. I know Lisa was feeling that with some of their ODHS staff as well. That was causing up to 60-day delays in start dates. That has thankfully been reduced. We know that our childcare providers are also seeing delays in the background check process, though more like 2 to 3 weeks. But one of the things that we hope to partner with the Oregon State Police on is what resources and supports they need to be able to prioritize and have the capacity to move the early care and education workforce background checks through more quickly. On the external side, we've heard it mentioned a couple times already today, but that need for sticks and bricks funding, as Margaret says, and our ability to invest in facilities. Similarly, we have constraints on how we can use the federal resources we've received, and the general fund resources we have very explicit uses, and we can't use them for facilities improvements or investments. And as we continue to expand access to programming, we're eventually going to run out of space until we get creative and find those resources to allocate towards facilities and infrastructure investments. And then, of course, just the staffing shortages and turnover that, again, we're all experiencing there, and trying to find creative ways with the one-time funds we have gotten to create some stronger retention and recruitment strategies, in addition to the hundreds of millions of dollars we've already been putting out through various one-time funding resources. Right now, the child care stabilization grants are open. This is $224 million from the American Rescue Plan Act that was specifically dedicated to our existing child care providers. It's got a fairly broad use of funds. It's available to our licensed providers and to our providers who accept subsidy. So really excited to keep that going, and we're getting many applications every day, and just appreciation to the CCRNRs and hubs who are working really hard on the ground to help providers through that process. And then I think as we look to kind of the emergent opportunities, there's a lot of work going on as we're trying to stand up the Department of Early Learning and Care, working through the transition considerations of moving such a big and complicated but important program like employment-related daycare, but also figuring out all of the functions that are associated with a new department, the functions that ODE has been sharing with us, the functions that are needed to support ERDC, and making sure that we really can start strong on January 1 and be ready to bring over the program, ERDC program, on July 1 of 23. I think the other thing that we're spending a lot of time on, Lindsay had mentioned House Bill 2166. So looking at the suspension, expulsion prevention work, that's another one that we're coming back to the legislature on, and really looking at how we can reduce suspensions and expulsions across our early learning settings. And then what are the investments needed in the system beyond just ELD or DELC, to help support families and referrals to other services, getting access to the mental and physical and behavioral health that they need. So there's more than we know we can just handle on our own as ELD. And then really excited to have started the Tribal Early Learning Hub work. As Valeria has talked about before, this is work that we wanted to do for a long time, and we're really excited that it started. The Tribal Advisory Committee just kicked off last week, so a lot of really good work ahead, and we're just excited to be able to elevate and recognize tribal sovereignty as we continue to design this work together. And then I think the last piece here is just how we're trying to drive equity for the state. So we're trying to take this opportunity as we stand up this new department to try to model what can be done. It's exciting that we can start a new agency now with so much work towards equity at an enterprise level, so much awareness of how our state systems need to change to be more accessible to the communities we're trying to serve, and be able to start with that as the foundation instead of trying to add that down the road like most of our state agencies have had to do. And so really excited to just partner with all of the agency directors that are here on the council, partner with the Higher Education Coordinating Commission and Ben Cannon, to really figure out how we best serve the early learning system outside of DELC, and with DELC as a strong partner, including workforce supports. I know that part of House Bill 3073 also called out opportunities to strengthen early intervention, early childhood special education coordination. So really excited to see how that work is developing in the coming months and bring that to the council, and where else we can be really focusing on leveraging efforts across our agencies to build the capacity we need to be successful and support community. So there's a lot of talking, and I'm happy to answer questions.
a lot of talking because there's a lot going on, Alyssa. Yeah. My goodness sakes. And among all of that, there's a new agency getting created. So questions for Alyssa, comments about current and also some of the future directions she's talking about. And we do have, as you probably know, we do have time on our agenda tomorrow to go into some depth on DELC. So you may want to kind of hold off on some of those questions until we have Alyssa and her team with us tomorrow afternoon. Other comments? Anne.
Hi, Alyssa. Thank you for that report. It's so great. It's really very exciting. I want to beat my drum that I always beat. And I'm really thrilled about the equity orientation. I think it's a really interesting point to actually create a new agency with equity at the center rather than having to retrofit the work. And so I would like to beat my drum about rural inequities and really how impossible it is for so many of our rural providers to actually survive, and raise again the issue of reimbursement rates for childcare providers and the rural urban differential, and the calculations that are being done by, according to quote unquote market costs as opposed to the actual cost of care. And I just want to make sure that I raise that all the time and say how much of a priority it is for us. And I hope that you can take that on as you continue to build the sort of the policy and regulatory infrastructure.
Thank you, Anne. Absolutely. And House Bill 3073 did call out the need to move to the true cost of care rate methodology from the market rate, which is what CCDF is also pushing us to do as well. And David, you can correct me if I'm getting this date wrong. I believe we have to have kind of our proposal ready by December of 2023. So we've got, that gives us time to work through the federal processes as well for how we kind of can co-create that, get the approval, make sure we're on the right track from a CCDF perspective, and then bring those final recommendations to the legislature. So there will be a lot of work there and how we are making sure that the needs of rural communities are reflected in that as well.
Thank you, Alyssa. If there's anything that we at the Ford Family Foundation can do in any way to help, we would be happy to do it.
Thank you, Anne. You are on my list, so I will be following up with some requests for you.
Thank you.
Well, and hopefully there may be some incremental steps that can be taken between now and a year from now, right?
Yes.
And not just wait for the feds.
Absolutely. No, there's a lot of work we have to do to get our proposal to the feds and then be ready to share that with the legislature in December of 23. So that work is going to be starting in the next couple of months. And David, you can add or virtually kick me under the table if I'm off on any of that.
Well, David talks next, so he can correct you all he wants, Alyssa.
Everything you said was spot on.
Okay.
All right.
And
Kali. Oh, whoops, Anne.
Sorry, to Sue's point about incremental steps between now and then, if there are experiments that need to be tried or models that need to be tested or waivers to try some new things along the way, again, we'd love to talk with you about it.
Thank you.
That's a great offer, Anne. Thank you. Kali.
I guess building a little off of what Anne was saying, I'm just struck by the opportunity to build equity at the core, but also ensuring that the engagement of different voices. And I know we've talked about this a little, Alyssa, but I'm recognizing that different communities have different needs. And so to build an equity-centered department, like inclusion of those various perspectives is just very important. And I think, thinking about how the council can be helpful. I know we're doing some initial focus groups and things, but we geographically represent diverse areas, and then we have different connections from a racial diversity standpoint as well. I just feel as though, my mind goes to how do we help you, how do we collectively help you engage the voices that can build this equity-centered space so that we can serve children well across the state. So I don't have an answer as to how it looks. I just hope that there are ways that we can partner in that.
Absolutely. Thank you, Kali.
Angie has her hand up.
Thank you, Sue. Alyssa, excuse me, sorry. I would really like it if you could speak a little bit more to workforce development. I know that's in your priorities, but it's something that just is really highly concerning to me as a provider myself, and witnessing firsthand how hard it is to recruit the qualified staff that we need. Just being concerned about the expansion that's coming up and just not feeling like we have the workforce that's going to be needed to continue the quality that we've built. So if you could just speak to that a little bit, I really appreciate it. Thank you.
Absolutely, Angie. So we've kind of broken down our professional learning strategies into 4 buckets. So we're looking at recruitment and respect. And so how we're building structures and supports that really attract people to the profession of early care and education, and especially focusing on those educators that represent the racial and ethnic and linguistic diversity of the children we're serving. We're also looking at preparation, degrees, and credentials. So how are we creating accessible, culturally and linguistically responsive credential and degree programs that can really help prepare our educators to work with young children? Professional learning is sort of that ongoing community-based training and the job-embedded learning opportunities that we can really try to root in the competencies of early care and education work. And then we've got our retention strategies. So how are we looking at workplace environments, foundational conditions like knowledgeable, skilled leadership that can support the diversity of our early care and education providers to implement those effective practices? So that's sort of the overarching framework. And I'd be happy to invite John Reeves, who's sort of leading this work with Margie McNabb. There is a very comprehensive spreadsheet of all the different bodies of work that we're trying to blend together across long-term funding streams like the Student Success Act and some of the one-time funds that we've gotten over the last year and a half with federal resources. But we're also looking at how we can be strategic with some of our expansion dollars as well. So for instance, as we work to recruit folks to apply for Preschool Promise, we want to think about, are there ways that we could use some of those remaining funds to help provide additional staffing to providers who might be caring for children experiencing disabilities? That was something we heard a lot during last legislative session. What additional training and supports can be provided with the funding that we have available that's program specific, in addition to kind of the overarching professional learning plan and strategies there?
Yeah, good question, Angie. Obviously, it's one that crosses all the agencies we've heard from today. So I think looking ahead, Council, and we'll talk about this more tomorrow, is there a role for us to play in trying to get a handle on how are the 5 different agencies approaching the workforce crisis that they all share? And are there any common denominators or common approaches that might make sense for us to either ignite or ask about or support? So workforce is on the list. Other questions for Alyssa before we move to David? Okay, and Alyssa, we know we will have more time with you tomorrow. Thank you very much.
Looking forward to it.
So David, last and definitely not least, we appreciate your part of the mural board because this is the interagency part.
Well, and I think, and Sue, I think our goal today is really, for this part of the conversation to provide you as council members a little bit of an opportunity to reflect on some of the sort of both cross-sector themes and cross-sector work that you've been hearing about so far. So, I think one of the great strengths of this council, has been your recognition that children and families don't live in particular sectors, that they have broad needs, and your commitment, to making sure that housing, health, human services, along with early care and education, are always part of the conversation. And I think that's just been one of the great strengths of both Raise Up Oregon, but also the way you've been able to leverage the agency directors and hear from them. Later this afternoon, and then tomorrow, you guys will have time to really think about what your priorities are for the next 2 years, as well as the actions that you as a council want to take. But we thought it would be useful, just as a step towards those conversations, to provide a little, since we've been hearing from the individual agencies, to have a little bit of an opportunity to reflect back both on what are the themes that you've been hearing from across the agency, as well as some of that work that also been hearing that really explicitly requires multi-agency collaboration. Since we only have limited time today, what we thought we would do just to help seed the conversation today is that, we went through the material from the agencies and the mural boards, and pulled out some of those themes that we were hearing in that material. And Remy, do you want to put up that part of it? And I know that we've been hearing other parts of the conversation. So what we wanted to do with this time is, again, we seeded a little bit of that information, but then wanted to hear from all of you to really build this out to make sure that, we going into the rest of the conversation, we have just some shared reflections on some of those themes and multi-agency work that was identified. So just to, kick us off, I think some of the common issues that we heard across agencies, I think every single agency director talked about the importance of centering equity and racial justice. I think we heard from Colt on what that's meant in terms of also hiring practices within ODE, community and family-driven policy development was, again, something that every single agency director spoke to. Liesl talked about the work that ODHS is doing to develop a new community listening framework. Diverse, qualified, sustainable workforce. Everyone also talked about that theme. I think Alyssa was just answering some questions around that on some of the current challenges, particularly in retaining workforce and compensating workforce in ways that address that crisis. Just a recurrent theme, I think, has also been the holistic needs of children and families and making sure that they are met, which I know has also just been a consistent theme of this council. And then I think again and again across agencies in different ways, in different forms, we've also heard about the need to address mental behavioral health of young children, families. And I think I would also add to that of the workforce that works with children and families. Some of the priorities that we've also heard from that explicitly talked about the need for multi-agency collaboration, increased cross-agency work with regional and local services, make sure that we're working together across agencies when we're also working with local communities. I think another theme that came out also in some of the discussions around that is also, as we're trying to work and partner more closely with community-based organizations, how are we also supporting those organizations in their own capacity building and to deliver those services. Margaret talked about some of the work that's happening with integration of affordable housing and early childhood. Mental and behavioral health of young children and their families, I think, again, was something that came up as work requiring multi-agency collaboration. Building referral systems to meet holistic needs of young children and families. I think when eligibility came up in multiple presentations, Pat explicitly talked about that as something that we need to continue to build on. And I think Alyssa also touched upon that, and also something how to connect that with regional and local coordinated enrollment systems. Colt talked extensively about how the work to make sure that children with special needs are really have the opportunities to be supported in inclusive settings, and some collaboration that needs to happen through DELC or with DELC on that work. Also discussed, and then a number of agency directors also talked about work to successfully stand up Department of Early Learning and Care and multi-agency work that's going to take. So these were just some of the themes that we noted originally from the material that was submitted to put together the mural board, and I want to thank all the agency partners for making that happen. But we also just wanted to provide a little bit of opportunity to allow all of you to reflect before you get to the next stage of your work on what were other common themes that you were hearing both in the mural board and today, and other places that you were identifying where you believe that to be successful, really multi-agency collaboration is going to be needed.
Awesome. Thank you, David. That's a great sort of synopsis and beginning point for this conversation. So council members, let's reflect on this for about 5, maybe 10 minutes, and then we're going to take a half-hour break so we can get our minds back again and check other emails or whatever, and then we'll come back. And Carrie McCann and Harriet Dichter from the Build Initiative are going to be trying to, in that half hour, pull together some of what we heard in the last 2 hours. And then that'll provide a basis for us to talk about how do we want to set up tomorrow's conversation. And then very importantly, we've got to adopt 3 rules today. So it'll be really important that we'll take the break, but that you come back for sort of the formal business part of this meeting. Thank you very much. So reflections on this chart and some of David's comments and tying in what we've heard for the last couple of hours from our the agency directors. Anything stand out to you? Anything missing?
This is Ann. I just thank you, David. That was a great summary. I see a couple of stickies here, and I think I just want to lift it up because Pat Allen was here about home visiting being such an opportunity now with the universal home visiting, the willingness of everybody to partner together about that, and just having it be a kind of a priority for us, because there's so much that's kind of in place, but it needs a boost, and there's a lot of willingness on the part of the various agencies, of course. And so I see that a couple of stickies sort of focused on that, and I just wanted to lift that up.
Yeah, thank you, Ann. You know, it's interesting in Margaret's comments about opportunities, that was one of hers in this co-location, and trying to make sure that home visiting is incorporated in some of those supportive housing projects. So.
And I think we've learned so much about it and about what it takes to coordinate it and to make sure that they work. So yeah, I appreciate you pointing that out too, Sue.
Yeah, well, and you in Douglas County, well, I guess bigger than Douglas County, you've had a home visiting coordination project or coalition going on for a number of years, right?
Yeah, and it's really been effective. You know, it's really starting to be very effective, and we've learned a lot about how you get that kind of coordination happening. And so I think there's a lot to work with there. Yeah.
Awesome. Peter.
I was just going to say, you know, you asked about what themes are coming up repeatedly. Obviously, social emotional learning is coming up over and over again. Workforce is coming up over and over again. I think those are tied together as well. And I really do. I think what's missing is, again, what's the price tag? What are we looking at? What does it mean to have a well-funded workforce with living wages and benefits that was capable of reaching the capacity we're trying to reach from birth to age 5? So I really would hope we do get a chance to focus on that and try to come up with that idea. What are we trying to accomplish financially in order to have a system that can work? And including living wages for the workforce and benefits.
Yep, great. Thank you, Peter. Kali.
One thing that I think is, I guess, missing, and it came up in the conversation. Well, you know, I was trying to highlight it in my questions to Colt. I don't know that it came through. Like, there has been huge learning loss, and the devastation of the childcare system, and the fact that, you know, there was a transition to remote learning in kindergarten and first grade. Like, the MAP may be a national assessment, but they look at RIT scores, they look at growth over time, and they're showing that it's the younger children that have been most impacted, and literacy in particular has been impacted. So this is a huge issue, and it starts early, and I guess it doesn't show up here. Like that whole piece of just skills doesn't show up. And I think how do we support that? And we've been talking, I think, for a couple of years about a joint meeting with the Board of Education. I don't know if that's the answer, but maybe it's a start to be able to look at how we support the transition of early childhood into kindergarten and literacy skills in particular, not that math and social emotional, like there's so many things that matter, but that feels like it's really important. And the data is telling us that our kids have really been impacted. And I've also heard schools, at least in, now that I'm at CI, there's multiple districts that CI is working with schools, both here and in rural areas, and they're all saying this is an issue. And there's not capacity in the schools to support children. They're short-staffed, probably more so in the rural areas than the metro regions. And so people are doing double duty. There's a school where the guys like in Young-Kala where there's a superintendent and a principal. So I just noted, knowing that there's not capacity, knowing that it starts early, phonetic identification and just words, language starts so young. Like, what can we do collectively to support this with our children and their families? So that was a mouthful, but.
Well, it's a really good point, and it has been devastating. You're absolutely right. So George, do you want to just state what you're writing?
Yeah, I just put it in the comments, but it was the same kind of stuff that what I got out of it was workforce development from a variety of positions that we need to have, whether in schools or whether in other agencies. You just need a lot of folks to do the work. And the facilities part to me is something that we need to figure out with partnerships and common use of I'll just say common use of spaces, but also that infrastructure and expansion. I think that's one thing that that gets in the way, especially in rural communities, is they don't have even enough for the infrastructure. And then that can create some buildings or some locations and versus just kind of finding empty buildings that aren't being used. I think in general, we need to also think about the infrastructure piece of it. To me, the learning loss, the same thing Kelly's kind of getting at, is that whether it's behavior, whether it's regulated, whether it's kids being in a place where they can have enough stamina to focus and pay attention, like we're in a tough time academically, and the more we can support at ages 3 on up or even younger, we got to figure out that. And then the next part is the parents or the teachers, the people that are working in these positions. They're experiencing kind of system strain more than they've ever experienced system strain and system fatigue type things, and that we've got to figure out how to help them be resilient and help them be excited to do the work that they do while they're going through a lot of difficult situations with children and families and themselves. So anyway, I think I heard that in different ways.
Right. Thanks, George. Really good point about supporting the parents. You're right. Anytime we talk about young children, we have to talk about their parents and caregivers who are also mentally stressed and beyond. Other comments or input? We'll have more opportunities coming up, but anything else to put on the sticky notes for now? Okay, David, thank you. That was a great piece of this very complex puzzle. Okay, Council, it is 3:23. So we're going to take a half-hour break. So let's come back at 3:50. I think we're even close to on time. Actually, we're right on what we had hoped for. Amazing. Let's come back at 3:50 and we will see what our fearless team of David, Harriet, Carrie, and Remy come up with as far as sort of a synthesis of what we've been hearing and talking about so far today. And then we'll see what else we want to add to it. If we have a sense of some of those things that really jump out at us to lead into tomorrow. And then at 4:30, 4:30, we're going to open up the business part of our meeting and do the rules adoption. So any questions about all of that? Does that all work for you guys? Okay, thank you all very much. We'll see you about 3:50.
Hey, Sue.
Yes.
Really quickly, I'm going to have to switch to the phone at around 4:30. Is that going to be an issue? I don't know if I'll have to look. I have to drive somewhere. I don't know if that'll be an issue on the rules piece, but I wanted to make you aware. Okay.
Yeah, thank you. That won't be an issue. We'll still have you for the quorum and to vote.
Okay.
So just so you drive safely.
I will. Okay. See you soon.
Thank you, Kelly. Okay.
Remy, when everyone else is going over the rules, can you carry me back into the small room?
Yes.
After we're done, after you move on, okay, thank you.
Got it.
We're prepared, so we have a little report ready.
I'm sure you do. I'm not worried at all about it. I'm happy to listen. Okay. I think we're good. I'll bet George is either listening or will be back soon. And same with Anne and Cully. Let's see if they are back. Oh, good. Hi, Angie. Thanks for hanging in there with us. Let's make sure we've got Anne, George, and Cully before we get this amazing report that's about to come. That was a great session. We had great input from everybody. Really cool. Whoops, where did you all go? There you are. So I'm wondering, Anne, George, and Cully, are you guys back? There's Anne, thank you. George and Cully, are you with us? I don't want them to miss this report because it's going to set the stage for our conversation in the next half hour.
Do you think that photo of Kali makes her look like a rock star?
Yes, with the microphone and stuff, absolutely.
Right. Exactly. She's like, I picture thousands of people out there cheering her on while she's doing some kind of dance step and singing.
Right, we're just missing the guitar.
Of course, in my mind, she is a rock star, so that makes sense.
Right, it all fits. It's interesting to see how many different photographs one could put up on these screens. Air guitar. There you go, Anne. It is a guitar. Okay, let me see when we're going to get them back again. Okay. So we'll wait a couple more minutes. Anne, is there a quick update on replacing the 150 childcare slots in Roseburg?
Yeah, thanks very much. Again, Alyssa, I just want to thank the Early Learning Division for being so helpful to us. So our local YMCA stepped in. So we lost the potential for 190 slots, but actually only 165 kids were enrolled. Our local YMCA stepped in, partnered with a local church, and opened up 5 rooms. So we got, I think, 55 or 60 kids enrolled there. But we have this, we've been developing a childcare coalition in Douglas County for a while. And we have something called Biz for Kids, business leaders for kids. We have our CCR&R, we have our local small business development center, who've all been in a coalition together, supported by a lot of others, to try and sort of do a childcare plan for and the Early Learning Division and the hub, of course, to try and sort of build out a childcare sort of quantity and quality increase in Douglas County. And fortunately, as a result of that, there were people in place who could sort of step in when this big center closed down. So they've been able to also find a few more slots here and make sure that people got jobs there and so on. We have not replaced the entire slots yet, the 160 that we lost yet, but I would say we're maybe halfway there. So the Wellspring, which was this one that closed down, closed on September 30th, and on October 1st, the YMCA opened up the 5 classrooms. Wow. I mean, it was a huge community lift. This is what you got to love about rural communities. It's like everybody said, oh, nope, we got to mobilize. I mean, people were there to take the equipment from the church over the old church over to the new church. And, it was kind of cool, but we still are missing probably 80 or 100 slots that we had before, not to mention that we had undersubscribed. So we're still working on it, but our CCR&R and the hub are really doing, and the Biz for Kids are really sort of reaching out and trying to get it done.
Wow, that must have left a lot of employers in the lurch.
Mostly our hospital. We have a hospital, and it's the hospital and the folks who work in the school system. Those are the 2 big ones. But Alyssa, I just want to thank you, because people from the Early Learning Division really helped to think about, waivers for getting this center up and running, helping to provide technical assistance to get licensed. Huge help. Thank you very much.
I'm so glad. And yeah, whatever we can do to keep rebuilding that lost supply, just let us know.
There's still a lot of work left to do, but we're working on it.
Yeah, that's great progress.
Yeah.
Well, that was a fast turnaround, Anne.
Yeah. Wow. We got, as I say, we had kind of enough of a network in place that we could mobilize. So that helped a lot. And I have to say that my number one lesson from all of this crisis is that it is so important to have invested in community capacity, community relationships, community visioning and planning, because all of those relationships have been mobilized in the time of COVID, in the time of wildfire response. And if we didn't have it, the places that didn't have it have not responded as well. And all of this, we as a foundation, we have a whole department called community building. And, sometimes people sort of say, that sounds all touchy-feely and stuff like that. But I tell you, it's those relationships that got mobilized, all of them. And it made all the difference in the world.
Which is absolutely why I think the council really should have some local and regional focus in the coming year, is to figure out what role can we play in really encouraging that and in supporting those local infrastructures like that. So congratulations. That's cool. All right. There's George. I was going to say George will be on in a minute. George is on. So we are ready to hear from Harriet and or Carrie about the next step of our process today.
Carrie, you're on mute.
Yeah, what we did was took what we heard from the discussion across the state agencies, your comments and reflection during the Q&A for each of the sections that were discussed, and came up with an initial draft list of priorities. And let me know if it's big enough to read on the screen. And so this is like a generalized like first cut. So this conversation is to give you a chance to see if there's anything missed based on the conversations and the things that you've been reading and thinking about since we put up the mural boards, and kind of reflections, because we know that this has to both probably get categorized or something's collapsed, or that some kinds of priorities for the council will look one way or another for tomorrow's conversation. But this was, Harry and I weren't going to start doing that work until you kind of got a sense of what was generated and what you thought of the initial list. Harriet, would you have other reflections to share about where this came from?
No, that was great.
So
what we thought we'd do is just run through the list for you first, and then because it's obviously very rough, and then ask what you thought you heard that we did not, if there are items missing to add to it.
Mm-hmm. And we thought we would take turns to give you a chance to kind of absorb what's here. So the first two are really kind of the broad, embedded, kind of in all strategies concepts, right? So racial equity is a value and a principle across, but we also heard about it kind of embedded in many different kinds of strategies across the conversation about whether it's who's being outreached to, who is the workforce being representation looking like, what's the design of materials, how are services being delivered, what's the knowledge of the workforce. So all kinds of different ways to realize equity were mentioned. They're not realized yet, but we heard a lot about different kinds of efforts to try to strive toward racial equity. And the second thing we heard about a priority was around family voice and engagement. Most of the state agencies talked about how are we engaging family voice in policy development, the design of service delivery, and how is implementation going. Also in the kind of their experience of the coordination across state agency efforts, even if that's not how families would talk about it. And it was raised by the council about possibility of shared process, that families talk about their life, not individual sectors or programs, and what's the kind of council's ongoing role to recruit and engage voices that are needed to be heard that maybe haven't been heard traditionally.
So I'll go on and do the next two. So workforce, I think we heard also as cross-sector, that workforce issues basically were cited across multiple agencies, and also specifically in some of these notes here are also focused on early care and education. And so issues arose around workforce in terms of recruitment and retention, compensation of the workforce. Alyssa went on, and we'll have a little bit more later on professional learning and other aspects of the workforce system. And then also that there was a lot of acknowledgement, basically, again, across the different agencies that were speaking, that the workforce issues are pretty critical in terms of family employment. Another one that we heard that I think has been mentioned in the past is the potential for an Early Learning Council State Board of Education partnership. And there were a couple of issues named to think about working on collaboratively. Cully raised issues around early literacy as a mutual area of interest. Several people raised up the issue of the prioritization of the new KEA work as being a shared interest across not only agencies, but also a potential priority place for council engagement. And then was mentioned as well because of the strong interest, basically, and connection around Part C and Part B, early intervention and early childhood special education, as the terms used in Oregon, around issues around inclusion in these programs with regard to the broader early care and education system, and also with respect to transition, basically as children who may be served in those systems are then entering into the K-12 system.
And so the next two kind of spelled those out a little more specifically, right? There's the invitation for future conversations on a culturally responsive KE8 development and what are the goals of that and what are the next steps. And then there was the realization across the mural boards about specifically about the inclusion and approach for children with special needs.
So the next one is child welfare and early learning. And I think this is the issue that the most dominant group of children in the child welfare system are actually the youngest children. And sort of the notion that focusing and having greater attention on the very youngest in the system, especially it was noted that children who've been removed from their homes and are in foster care and attending to their range of developmental needs within the system. That one perhaps would be broadened to not only include the child's early learning needs, but the whole gamut basically of health and broad range of supports for kids who are in the child welfare system. The next one after this came up a lot. And so we actually had some trouble deciding how to name this one, but throughout the entire afternoon, people talked a lot about physical infrastructure and the importance of physical infrastructure. And so we named it here both as coming up significantly in terms of work in housing, but also work in early care and education. And so people talked about both issues of co-location. Some of that work is beginning to start, but also not co-located, but simply the repurposing of facilities, the creation of facilities, and so forth. And then thinking about these issues in terms of facilities use. It was mentioned as well about the potential to look at priority populations and how they're served through multiple funding streams.
Also kind of brought up in a couple different ways was a rural equity strategy. So it was included in this kind of physical availability of housing and the support to the development of ECE facilities and the kind of broader range of systems that need to be supportive around transportation, land use, as well as the actual sticks and bricks, as I learned the term from Margaret over these several council meetings. But it also came in on how do we determine the services to be delivered, even if you do have the physical spaces. And so how are the costs determined by what it actually costs instead of market rate determination. And then the next one is this kind of specific angle on health equity that Pat mentioned about them striving with the 1115 waiver to create continuous eligibility for children up to age 6. The health insurance options that were raised about how to understand what could be better for the early care and ed workforce. And I'm assuming other kinds of similar workforces in other sectors could benefit from what was raised. And then he mentioned the rule that they're already moving forward with the postpartum eligibility for women up to 12 months after giving birth instead of 2 months.
So next is social, emotional, and mental health. And of course, this has been an ongoing conversation for the council. There was a lot said here about this, and we tried to summarize kind of the places where we heard it because it was intersecting health, mental health, education, early learning, child welfare. We probably missed something here in that. And we heard about that in terms of support services, mental health services across the lifespan, so many different venues and sectors basically coming together to support the mental health, not only of children, but also of family members and of workers, basically. And I think all of those were raised up as people were talking about this. And then mentioned as well, and we'll get to this later on when we talk about financing the system, but that came up here, what resources are needed to have a robust approach in this area. And then the last was, of course, with this metric being developed, an opportunity and an invitation actually by OHA for significant involvement by the council in the next phases of the metric. Next after this was home visiting. This also surfaced in several different ways because there was both the work to support the scaling and implementation of the state's universal home visiting program, but also there are other home visiting models that are in play in Oregon, and the piece around the potential focus on the coordination and potentially expansion of the other models as well.
There's a lot of discussion that we heard actually across multiple state agency directors about the commitment to DELC and its formation and the opportunity that a new department offers, both for the racial equity goals as well as what that department will be bringing together in a new way. And then for childcare was raised by across several conversations. Its quality, being able to stabilize it, the supply was talked about, the needs for families, the recovery for communities. We also heard that it's impacting the workforce that actually delivers the other kinds of supports and services of our state agencies. If their workers can't find childcare, then they can't provide their other supports and services. So it's kind of every angle of the systems impacted by the affordability, supply and quality of childcare. And then there was ongoing work that you wanted to do in childcare around policy and compensation.
So Spark, of course, is connected because Spark is the ELD strategy around quality improvement. And that was called out as an area needing further and deeper attention. And then we also heard in number 16 around overall financing strategy. And this got very big because it got discussed as the whole of the early childhood system. Okay, what would a scaled system look like with our people who are well paid for the work that they're doing? And I think this was discussed in a bigger way than early care and education. It was really the components of an early childhood system. And in the past, we noted that sometimes that's been talked about in effect as doing a children's budget. So it's been articulated a few different ways there.
Number 17, as it was raised multiple times, of not only thinking about the collaboration alignment across the state agencies forming the broader system, but also the cross-agency collaboration for the regional and local services. How are the different kinds of offices and partners coming together? But part of the conversation was also around how really building the capacity of local partners, understanding what they're already being asked to do, and what does it mean to do this kind of cross-agency collaboration to have more impact. And then a complementary conversation was really about continuing to think about how to leverage the early learning hubs and what's their role across the cross-sector strategies as they're also thinking about rollout. And we heard an example of that connected to the universal home visiting from Kate.
So moving on from that, and I just want to comment on the hubs. A lot of the agency directors discussed the opportunity for the hubs basically to be a more integral partner or player in terms of cross-sector work. So connected to that too was referral systems to meet holistic needs. That was raised with this idea that we're seeing that it's sectors together and abroad, while there are specific initiatives or programs that need strengthening, that also to the focus on understanding that children and families don't exist based on one service or one sector, and that supports may be needed to help people get to what will work for them. That connects, I think, to number 21, eligibility, where there was a lot of affirmation basically around the support and a potential to focus on ongoing implementation so that it continues not only to do well for where it started, but to actually have an expansion. And the things that were talked about as opportunities for expansion were figuring out the connection of one eligibility to coordinated enrollment for work that's happening in the early learning division now, and then also the integration and incorporation of eligibility for current ELD publicly funded programs of Preschool Promise and OPK. I don't think there were others mentioned, but based on what I think I know, there's still other possibilities in other agencies to actually bring programs into one eligibility for a more facilitated entry point for families in the community. And then the last thing that we just tagged here was the potential for private sector collaboration. There was a lot of focus in today's conversation from agencies about public agencies and public policies, but some did raise this question basically around the council's role in terms of basically prioritizing also how private sector comes in. And actually, Anne gave a nice example of that, I think, when she was just talking about some of the work at home, where you were left without the childcare facility and you had some good private sector mobilization that had grown out of previous community building efforts to support that work. So that is the best that Carrie and I could do in our pages and pages and pages of note taking that we did while everybody was talking. And we were thinking that you all might have heard some things differently. And so perhaps you would have additional things that you thought ought to be considered for council, whether cross-sector or single sector.
Wow, as always, nice work. Very nice work. And I see Anne's asking a question about the one eligibility. For Alyssa, for you.
Yeah, so we're working with Alvarez and Marsal on all the components associated with the ERDC transfer, and this is definitely one of the more complex ones. So we're working with OHA and ODHS on kind of the governance model, how DELC would join that governance model, how the prioritization works, and what timelines and costs would be to bring in additional programs down the road. But I think everybody agrees that we don't want to break anything or decrease access and coordination for families. So while we're looking at what happens with the one system, we're looking at that alongside the coordinated eligibility work. And are there any costs with giving DELC access to the one system? What does that access look like? Because there's so much more data than we can have access to. So those are all the conversations we're having right now.
Is there anything that we, as the Early Learning Council, need to do to facilitate that, to smooth that, to use our incredible power and might that we have to cause it to happen in a smooth and easy way?
I don't think this area needs that. I think everybody feels really strongly about leaving ERDC there. So in the coming weeks, we'll have a clearer sense as we get closer to that January 15th report around cost, timing, if there's kind of additional supports we'll need to do the work well and within the time needed. And that's where I think it could be useful to bring you all up to speed and make sure that you're talking with legislators and other policymakers about what needs to happen to get that over the line.
Go ahead, Peter.
I was going to say along the same lines, I'm not sure how this interacts with the CCOs have a mandate for a community closed loop referral system. And many are using Unitas, the Unitas platform. And I'm just wondering how that's going to fit, how that fits together with one. I know one focus on eligibility, but referrals out to other services could go through the Unitas Connect Oregon program. I'm hoping those discussions are happening.
No, it's a great question. I'm happy to check in. Definitely don't want to speak for Pat and kind of OHA's plans, as they're obviously a huge part of that governance structure, but happy to check in on that and where there might be some opportunities to leverage that approach.
Thanks.
You know, Alyssa, I think I remember being in several conversations with early childhood folks. The frustration I remember with the one system was just that we were such a low priority as they were putting it together and then piloting it, that it was going to be a year or two before they'd actually get to some of the changes that early learning or early childhood thought were needed. So I think, you know, I don't know, maybe that's different now and we're actually equally at the table with the big monoliths, OHA and ODHS, but that may be a place where the council could help play a role.
Yeah, I think now that the one system officially launched in February, we're in a very different place than we were 2 years ago. But that is going to be part of what we're kind of working through with governance. At the end of the day, it's not that that DELC will be small compared to OD and ODH or OHA and ODHS, even though we will. It's more that the ERDC investment is so small compared to the investments in SNAP and the investments in other programs that are part of the one system. So it's not about the agency, it's about the program size. That being said, one of the things we'll be exploring is, how much does available funding play into that prioritization? So if we have one-time dollars, or able to identify key resources to implement the changes, how does that play in? So that's some of the prioritization work that we're working through. I think the advantage of the one system is that everything is connected. The challenge is all of these programs are incredibly important, and making the changes to those programs are incredibly important. And so how you prioritize childcare subsidy against SNAP, against OHP, those are really difficult conversations, which is why they have a very robust kind of prioritization process that we're learning about.
Got it. Okay, thanks.
I just want to say, I'm sorry I distracted us onto that point. I just want to sort of comment on the summary that you all did, and I think that you captured, I don't see anything major missing. I think you did a great job. So I just wanted to say that.
You did do a great job. As always, you've done this before, we can tell. Excuse me, how about throwing your list up again? Yep. So we can just take another look at it and see if there's anything missing, or anything else that council thinks we ought to be considering.
So Carrie and I thought, while you're doing the next part of the meeting, we were going to go and try to get the list more organized, which we have done before when we've done this, and try to get better buckets for you. But we just couldn't get our minds around that when we were working on it during the note-taking and break session.
Well, this is amazing for a 22-minute break session. We're all very impressed. The only thing that's not explicitly there, although it's embedded in a couple, is calling out the suspension expulsion word.
Okay, yeah.
And that's going to be a big part of our rulemaking. So it may be wise to throw those words in one of those. It could,
and that's, you're talking about specific to ELD's work, Sue, or are you thinking within the overall social emotional health, which is very cross-sector?
And I was thinking more of that because I know OHA is going to be heavily involved in figuring out what's the prevention program look like. So that was my only comment. Any other comments before we move on to our business meeting? Okay, I have a
quick comment. I guess it's more of a wondering. This is too many, obviously, priorities. And so I don't know what is the lens through which we're going to discern and whittle down what our actual priorities are. Like, is there a tool that we're going to use because all of these are important, all of these were talked about, but we can't do all these. Like, I don't know. I'm just wondering, when I look at this, I'm not clear on what our priorities are still, if that makes sense. So I'm wondering how we're going to arrive at that.
So I'll let Harriet and Carrie talk about that. How are we going to do that tomorrow?
I mean, one question is even how Harry and I might go categorize those this evening for you to look at. I was wondering if you guys saw categories. I think there were places where there was an explicit invitation to the Early Learning Council that there will be other agency processes where they would be seeking the council input. So that would be one kind of work. It seems like when Alyssa just gave the update on one eligibility, that would be something to keep apprised of, because Anne asked, like, is there a specific action that the council needs to take right now? And the answer was no, not right now. So there might be a categories of wanting to keep apprised of or want to know about progress or upcoming barriers that the council could, and then there might be some things that the council wants to specifically do or host or have a process around. And so I think that's where my brain was going, but that's but that's as clear as it got.
I just wanted to add one other thing, Cully, to start to respond, which we've been talking to Sue about, and which is in addition to what Carrie said, where are things where agency had said, I'd like to consult with you, right? And where it may be people are coming forward because they want to make sure you want to be well informed. That's a different kind of priority. Perhaps that's not as active, but the other one is cross-sector things. Basically, I think Sue has been very focused and started the meeting actually around the cross-sector responsibility of the council. And so I think that's one frame. And when we go through, I think we can pull out the things that are cross-sector. And the other one I think I would just draw to people's attention here is as well that you had a number one priority last year. That was the creation of DELC. And, that may be a super priority because actually almost every agency had said that they thought a priority was actually the successful standing up of DELC. So those may be frames, but when we go back through, we'll try to maybe organize in a manner that will assist you all in debating and deciding, right, where it is your energy and attention is going to best be used. I think now I've noticed that Anne found something we missed. Okay, so we've got that, Anne. Okay, the disaster, this issue around the capacity. And we did hear that, Anne, and I think we probably didn't do a good enough job of articulating part of this part around building local capacity. You talked about that quite a bit, so did others. And I think we thought it was there, but it must not have been there. Well enough said.
Yeah, so Cully, I think what Carrie and Harriet are outlining for tomorrow sounds like a reasonable way to try to categorize these. Sort of, what have we been asked to participate in? What, how, and some of it may be just keeping us informed about progress. So presentations at the council. And then certainly looking at the cross-sector versus just the siloed pieces of this, maybe great buckets to look at. The other piece I would throw in, and I mentioned in my opening comments, a variety of roles that the council can play and does play. So we may want to use that as another filter as we look at priorities and say, okay, well, if that's a priority, what role does that mean we're going to play? To try to advance it or implement it. So, and Harriet and Carrie know the role options well. So we may roll that into that conversation and categorizing as well. Okay, so are we ready to move on to rules? Drum roll. Okay, Carrie and Harriet, thank you.
Thank you
very much.
Remy, don't forget to put us in another little room by ourselves.
So they can go back to work.
I'm on it. I already did it, Harriet.
All right. Okay, council. So now we're going to move on to the business part of our meeting as opposed to the sort of strategic planning part. And this, as you know from the agenda, is where we're going to hear from staff about some proposed rules that we need to review, modify, whatever, and adopt. And as you know, we did receive one piece of public testimony. As you know, for the retreat, we always ask that it be in writing. So it was in writing and was distributed to all of us. So thank you for that input, and we will refer it to Alyssa and her staff because it was focused on early learning, early childhood. Let's move then to the first rule, and I will say hello and welcome again to Kelly, who is on, and we have met before. So Kelly, welcome back. It's nice to see you again.
Thank you, Chair Miller and the Early Learning Council. My name is Kelly Scales, for the record, and I am here to talk about two pieces of rulemaking. I know that they're in your packet. So the first one is a pretty simple one. You've seen it before. It's the rulemaking related to Senate Bill 757. And really, we passed that temporary rule for conditional enrollment. So we'd be asking the council today to vote to promulgate that into a permanent rule. So I'm here to answer any questions the council might have, or if we need to have a further discussion about it.
So we have seen this before. Council, any questions about conditional enrollment, which should help the child care world? Should be a welcome change. So this is going from temporary to permanent rules.
Correct.
All right. So how about the motion, which is obviously in our packet?
I would love to move to adopt this recommendation.
Great. And do you mind reading the motion that's in our packet?
Oh, sorry. I move to adopt the proposed rule language dated October 26, 2021 that updates Oregon Administrative Rule 414-061-0090.
Thank you. Is there a second for that? Peter Buckley seconds it. Okay. I understand, council, from staff that we have to read all of the OAR numbers and stuff for the record. So thank you, Anne.
I apologize if I stepped in and you had already primed somebody else to read that.
I have a feeling anyone is happy to, to get these read. Okay, any discussion of the motion? If not, those in favor, please say aye or raise your hand.
Aye.
Aye.
Aye, aye. Any opposed?
Aye.
I'm guessing, Kali, that's an aye in support.
Yes. Sorry. Aye in support.
Oh, that's right. Thank you. That's right. She's in her car. Okay. The motion passes unanimously. Kelly.
Thank you. The next piece of rulemaking that you have in your packet is related to some rules that we also had in temporarily in response to our COVID rules. We had to put them in place basically once the state of emergency ended, that allowed us to put in some extra guidance and requirements to deal with COVID. Most of those are exactly as you've seen them before. There is a slight change to the aid 2 qualifications. We've added some additional training requirements for aid 2s that will be working with infants and toddlers. We felt really strongly that because they're such a vulnerable population that we wanted to make sure that the staff working directly with them had the qualifications and the experience to be able to be alone in a classroom with infants. And we also are moving to permanently, hoping to permanently adopt a rule that allows them to supervise a classroom for up to an hour at a time. And that's really in response to the staffing crisis that most of our programs are experiencing, just to allow them to have a little bit more flexibility in how they're using their staff. There is a sunset date on that for the end of June of 2022, just to allow the providers to kind of adapt back to the new normal after we've been allowing it for all this time. Does anyone have any questions about any of those, or can I? Yeah, Anne.
So on the CPR part of it, are you expecting that it will go back to hands-on training at some point just because of how valuable hands-on training is?
Yes, absolutely. And we had originally proposed that we would require the online component starting in June, but we were doing our engagement right in the middle of the Delta flare-up. So a bunch of the providers said, well, we don't think that's going to be enough time. So we extended that to last until the end of, until June.
Okay, any other questions from council members? If not, I would love to have someone, oh my goodness. It's a long draft motion, but if Anne or Peter or someone will read all of those words and numbers, it would be great. Peter.
I'd be happy to.
Thank you.
I move to adopt the proposed rule change language dated October 26, 2021 that updates Oregon Administrative Rules 414-205-0120 and 414-205-0055. I move to adopt the proposed rule language dated October 26, 2021 that updates Oregon Administrative Rules 414-300-0110, 414-300-0120, and 414-300-0180. I move to adopt the proposed rule change language dated October 26, 2021 that updates Oregon Administrative Rules 414-350-0160 and 414-350-0115.
Wow, I think you've been in the legislature before. How fast you read those numbers off. That was impressive. Is there a second for that very long motion?
This is Angie. I will second.
Okay, thanks, Angie. Any questions or discussion about the motion? If not, those in favor, please say aye or raise your hand if you're on mute.
Aye.
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 All right. Any opposed? Motion carries. Thank you very much, Kelly. We appreciate all the work that you're doing as well as being with us today.
Oh, thank you so much, Chair Miller and the council. I appreciate your time today. Have a good day.
All right. Thanks, you also.
Thanks. Bye.
Okay, and now we're going to switch to, sorry, lost my agenda. Who's the lucky person who does this one? Is it Jay? No.
We are moving on to Valeria Atanasio, who will be presenting the next rule update.
Oh, okay. Hi, Valeria. Nice to have you back again. Good to see you.
Thank you, Chair Miller and members of the Early Learning Council. My name is Valeria Atanasio, Tribal Affairs Manager with ELD, for the record. I have been asked to present to the ELC today regarding the following council action requests to propose temporary Oregon administrative rule language related to commission and council reimbursement. As the Tribal Affairs Manager, I also act in the capacity of serving and representing our tribal partnerships with the 9 federally recognized tribes. We learned through the process of creating the Tribal Advisory Committee that the ELD unfortunately is unable to reimburse this legislatively created committee for their commitment and participation in advising and making recommendations for creating a tribal early learning hub in Oregon, including the drafting of tribal early learning hub rules. The ELD recognizes that this commitment by our tribal partners should not create any undue financial burden, and from an equity standpoint, we would not seek this level of engagement without sufficient support to those committee members. This council action request puts forth temporary rule language to reimburse boards and commissions that are legislatively created, such as the Tribal Advisory Committee per House Bill 2055, passed in the 2021 legislative session. By adopting these temporary rules, the ELD will be able to extend the offer of reimbursement to all appointed TAC members in effort to remove barriers that may exist for members in their participation with this important project. It is important to note that these are considered temporary rules before you, and the ELD will plan to bring them for permanent adoption in the early part of next year, 2022. If you act in adopting these temporary rules, we will be able to provide reimbursement for our Tribal Advisory Committee members. As you may be aware, this work has already begun. I'm available if you have any questions or needs for clarity.
All right. Thanks, Valeria. Questions, Anne?
So are we adopting these rules for all of us as well, or is it for the tribal members only?
I'm happy to take that, Valeria. So we were not aware that when we passed this legislation, we did not include language in the bill to allow us to reimburse the Tribal Advisory Committee specifically. So this is just giving us the ability to reimburse that committee. It's different because it's legislatively created. Any work group that the Early Learning Council creates, because we have authority to pay you, we can pay your work groups and subcommittees, but this is a legislatively created body, so we need additional authority to issue payment.
I have another question, just in case. Have they been will they be made whole if they've been meeting for quite some time? Or is it just moving forward?
Go ahead, Valeria.
Thank you. Yes, we've only had one meeting in October, and we plan to reimburse for time spent.
I'm ready to make a motion.
Okay, George.
Madam Chair, I move to adopt proposed language dated October 26, 2021 that temporarily adopts Oregon Administrative Rules 414-055-000, Rule 414-055-0005, Rule 414-055-0010, and Rule 414-055-0015.
Well done, George. Thank you. Is there a second for that?
I'll second.
Thank you, Kali. Seconds it. Any further discussion, questions? Those in favor say aye or raise your hand, whatever.
Aye.
Aye.
I'm waiting for Kali. Aye. Any opposed?
Oh, I thought because I seconded, I didn't need to say aye too. Sorry.
Sorry. I don't think you needed to anyway, but I'm glad you did. Any opposed? No. Motion carries unanimously. Very exciting. Valeria, since we have you here, will you just give us a quick update on the first meeting? And I think we all would love to get a list of who's on this advisory committee and what tribes are they representing and what's their meeting schedule. And we asked, I think, at an earlier meeting that we really be kept apprised of how this tribal hub is developing. So maybe you could give us a little update right now.
Sure, no problem. Thank you, Chair Miller and the committee or the council. Yes, we have just had our kickoff last week for the Tribal Advisory Committee. We have participation from each of the 9 tribes in Oregon, or commitment to participate to elect members. You can find more information, and I'm happy to also put this all in an email for an update for you in writing. We have a web page now that was created, and it's on the Early Learning Division website, where you'll be able to access the names of our committee members, meeting agendas, and relevant information as this is following the public meeting laws under House Bill 2055. We had a great kickoff, I can share. Lots of things that we're learning, and we're still listening to our tribal partners and really seeking their advisement and direction on how we continue to carry this work forward. And it seems like we are setting our foot in the right direction. I don't know if you have anything additional to add, Alyssa.
I was wondering, Angie, if there's anything you wanted to share as you're sitting on the committee.
Thank you for offering, Alyssa. I'm sorry, I'm just not feeling very good today, so I'm gonna decline this time, but I promise to have more to share next time.
Absolutely, Angie. No, I think it was a great start. As Larry said, we're going to be working really closely to make sure that this is a true government to government relationship, and that we are really elevating tribal sovereignty throughout this process, and so as we're kind of coming back to the council with updates, we'll factor that in if there's any adjustments to timeline, and really making sure that this is consistent with the processes of each of the 9 federally recognized tribes, recognizing that each tribe has different processes to go through. So really making space to do this work right and do this work well, recognizing sovereignty at the center. I think, to Valeria's point, this was just the kickoff, so no decisions were made. This really was sort of grounding in the goal of the tribal hub, the role of the TAC, and sort of rulemaking and hub design. So we'll have much more to share in the coming months on kind of the weedy details of what this tribal hub starts looking like.
All right, it's very exciting, and I think we all just will, and that's great to know that it's on our website, so we can go there and see the members and stuff, Valeria. And Angie, I want to thank you for serving as our council representative on that committee. We really appreciate you adding that to your long list of commitments. So thank you, Angie.
You're welcome.
All right, so we have finished with our rulemaking. Wow, I think we have finished with this day. Let's see, so tomorrow, as you know from the agenda, we're starting once again at 1 o'clock, and we will be hearing from Alyssa, as well as, let me grab this day too. Sorry, too many papers in front of me. I know we have Dr. Khan, and then also a representative from the consultant from A&M, right? Alyssa, talking about DELC.
Yes, we will get to introduce some of the Alvarez and Marsal staff to join us for kind of this DELC agency design update.
Great, which everybody on this call mentioned when I talked to you earlier that was a high priority, is to find out how's the implementation coming. So we will do that first thing, and then we're going to talk about equity and hear from Kali and Peter, sort of a summary update of how their listening sessions went in the last couple of weeks, and then look ahead to further ones, but seeing how those listening sessions can fit into an overall equity strategy for us. And then last and definitely not least is developing what is our work plan, what priorities are we going to set for 2022? And what roles are we going to play in getting those strategies implemented? So it'll be another exciting day. Any final comments from council members, questions, feedback for tomorrow, things we should do the same or change?
I liked having the break. Having a half-hour break to get things done in the middle was helpful.
Right. And speaking of that, we've got a 20-minute break tomorrow, projected to be about 3 to 3:20.
Great.
Just in case you're trying to do your own plans. Yeah.
And thanks to all the staff for all the work.
Yeah. We all have staff things, so we know there's a lot of work that goes into getting us here today. Anne, did you have a comment?
I just really appreciate how the agency directors show up, and it's really pretty impressive. They take this seriously, and they work and they put their things into the mural board. It makes a huge difference, and I know that they have a lot of things going on, but I really appreciate their presence. It was genuine and authentic, and I felt that way, and I want to thank them.
Yeah, I sure agree with you, Anne, with our fearless ELD leader still on the call. Thank you, Alyssa. And, it was interesting when I talked with Pat in advance of the meeting today, and I said, well, we're going to be meeting monthly, except for the summer next year. And we're thinking of asking the agency directors to maybe come every other month and plan the agendas accordingly. And Pat's reaction was, I'm going to put it on my calendar every month because early learning is a priority for me, and it has to be a priority for the health authority. So that's, just lining up with your comment, and that our agency directors are taking this work very seriously. So it'll be nice when we can do it in person again, as we did in the past, and actually have all of that relationship building that can happen a little more easily in person, although we're getting pretty good at it on the screens with no alternative. Okay, anything else? Great comments. I know Harriet and Carrie are off in their own little room, but please tell them again how much we appreciate their help, Remy and David, when you connect with them, because we will be reliant on them for tomorrow's conversation in a big way. Okay, thanks everybody. And Alyssa, we're excited to hear about DELC tomorrow morning.
It'll be great. Thank you.
Or afternoon, sorry, tomorrow afternoon. Oh, wait a minute, before you sign off, speaking of morning and afternoon, So I just ran out of time recently, but I want to talk tomorrow at the end of the agenda. You've probably noticed the calendar for 2022 is on the agenda. And I understand from Remy, Alyssa, that if we switch to mornings, it would work for you and your staff meetings. I don't know if you've heard that, Alyssa.
Yeah, Remy, did we finally land we could make the shift?
Yes, I talked to Sherry this morning, and
Great.
yeah,
Okay.
yeah.
So council, what I'd love to have you do, I've already heard from Peter and from Anne, but if you would look at that calendar that's in the council packet and see if we switch to mornings instead of afternoons in 2022, would that work for you? And Angie said that she can make mornings work for almost all of them except for one. So if you guys could just look at that between now and tomorrow at 4:30, I would really appreciate it. And Donna already sent me yours, Anne, so you don't have to worry about it. Okay. Okay, and Peter, I'm assuming you'd love to go to mornings, so you don't have a standing conflict. Yeah. Okay, we'll see if we can do it. I assume morning would be 8 to 12. So think about that. Okay, thanks everyone. See you tomorrow at 1. Have a good evening.
Thank you, Sue.
Yep, bye-bye. Get well, Angie.